The House will come to order. Prayer by the chaplain.
Heavenly Father, we come before you today with the hope that our hearts are full of gratitude. You do so much for each of us that a lot of times goes unnoticed, but even in that, you prove to be faithful over and over again. Thank you for always working on our behalf. I want to thank you for all those in this room who have answered the call of service to our state. It is not an easy mantle to take and comes with overwhelming pressure, but we serve a God that says he will carry every heavy burden if we come to the place of trusting him with them. But even greater than that, you said you'll make every trial, every hardship we face into something good for all those who love you. I pray for every person represented in this room, every husband, every wife, son, daughter, every person they love who have sacrificed to make this work for our state possible. I pray that they all experience great health in their body, mind, and spirit, so that they do everything with excellence, endurance, and most importantly, wisdom. Especially as they go into these last days of session, I pray that every decision is made with humility and full awareness of the needs of the people in every part of the state, big and small. Lead them, speak to them, God. We want your will to be done in this state. I pray for all the support staff that work so hard to make the daily grind for these representatives far more manageable. Bless them for all they do. And last, I pray for unity. Help us find common ground with each other. Heal every broken relationship, and I believe it can happen because I believe with all my heart that nothing is impossible when you are involved. Nothing is impossible when we give control of our life to you. May the Lord bless you and keep you, and may his face shine upon you in this place and everywhere you go. In your holy name I pray, amen.
Amen. The chaplain for today is Pastor Austin Ben Mailhot from Watermark Church in Stillwater, Minnesota, and the son-in-law of Minority Leader Damath. Pledge of Allegiance. Please remain standing and recite the Pledge of Allegiance to the flag of the United States of America. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. The clerk will take the roll. Yep.
Just a heads up, Representative Erdal is going to do a thing about some for today. He was going to do it before the recess, kind of in that little recess announcement period, but we're not going to do that. So I'm just going to, before we do the journal, I'm just going to call on him and get that. Okay. And then we can get on our way away from that.
The clerk will close the roll. A quorum is present. I recognize the member from Meeker, Representative Erdahl.
Thank you, Mr. Speaker and members. A very happy Sitten Mai to all of you. This is the 17th of May, Norwegian Constitution Day. Norway at one time was part of Sweden, regrettably. And in 1814, on the 17th of May, a constitution was signed and declared Norwegian independence. Now, somehow in the minds of Norwegians and Swedes, that meant that they were still together in a union until 1905, at which time Norway became a sole independent country with their own monarch. Now, obviously, the impact of Norway on Minnesota has been immense since our founding. Today, we have over 810,000 people in Minnesota who have Norwegian ancestry. Norwegians helped to settle this state. They fought in the Civil War. Our culture is rich with Norwegian heritage, words, foods. Some could even claim the Minnesota Vikings. And many of us in here today have Norwegian ancestry. I know Representative Robbins, Representative Nash, Representative Lilly, probably many more. So this is a great day in Norway, certainly impacted in Minnesota, a day that we should always remember. Sitten Mai, Norwegian Independence Day. So, Naven Vatar, Manatak, Sitten Mai. Thank God for Norwegian independence. Thank you.
Members, with the noise that is outside of the chamber, I would respectfully ask that you use the side doors, and would also ask the Sergeant-at-Arms and her team to encourage members to use the side doors so that we can preserve order and decorum here in the chamber. The clerk will read the journal of the preceding day.
Journal of the House, 93rd Session, 2023, 71st day, St. Paul, Minnesota, Tuesday, May 16th, 2023.
If there is no objection, further reading of the journal will be dispensed with, and the journal will be approved as corrected by the chief clerk. Hearing no objection, the journal is approved as corrected by the chief clerk. Introduction of bills. The following House files have been offered for introduction today. The chief clerk will report the House files and give them their first reading.
Introduction of first reading of House Files 3326 through 3327.
First reading House Files 3326 through 3327. Messages from the Senate.
Message from the Senate, Madam Speaker. I hereby announce that the Senate has concurred in and adopted the report of the Conference Committee on Senate File number 2744. The Senate has repassed said bill in accordance with the recommendation report of the Conference Committee. Message is signed Thomas S. Bodern, Secretary of the Senate. Conference Committee report on Senate File number 2744, an act relating to commerce. The report is addressed to the Honorable Bobby Joe Champion, President of the Senate, the Honorable Melissa Hortman, Speaker of the House. We, the undersigned conferees for Senate File number 2744, report that we've agreed upon the items in dispute and recommended as follows. The report is signed by 2 of the 3 members on the part of the Senate and 2 of the 3 members on the part of the House. Stephenson moves that the report of the Conference Committee on Senate File number 2744 be adopted and that the bill be repassed as amended by the Conference Committee.
I recognize the maker of the motion, the member from Anoka, Representative Stephenson, to explain the report.
Thank you, Mr. Speaker. Thank you, members. I am pleased and honored to bring before you today the conference report on the budget for the Department of Commerce. This is a phenomenal bill that we can all be very proud of. It achieves things that have been long sought by people in this body and outside these walls, and I am excited that they will finally become law. We talked yesterday at some length about the word transformative and whether that is a good thing or a bad thing. But I am here to tell you that some things are in need of transformation, and this bill accomplishes that. We should all be able to agree that the way that we access prescription drugs in this country is in need of transformation. People should not be choosing between paying the mortgage and paying for the drugs they need to live, or rationing the health care that they need and dying because of it. And this bill takes us in a great step towards changing that practice. It includes Mike Howard's excellent bill to cap the copays that people pay for the drugs they need, like insulin and EpiPens, the things that we all hear when we're out talking to our constituents. It includes a ban on price gouging of generic drugs. It includes the strongest prescription drug affordability board in the country that will make meaningful change to bring down the costs of drugs that people need to live, and that a few enormous pharmaceutical companies are milking for every dollar that they can get. It includes protections on mental health, the crisis that is gripping our country that is talked not enough about in this body, including bills to recognize collaborative care and psychiatric treatment facilities, but also a bill that Representative Cagle has worked on for years to create a mental health parity accountability office in the Department of Commerce. Because what good is it to have a law that protects mental health access if we don't enforce it? We need to enforce it, and that's what this bill will do. It also will make sure that the hard-won gains that we have around access to preventative services are preserved, no matter what ideological extremist judges in other parts of the country rule. We had a judge in another state rule unconstitutional the federal protection about preventative care. We're going to enshrine that in Minnesota law so that Texas judges can't stop Minnesotans from having access to PrEP and PEP and cancer screenings and all of the other preventative care that they deserve to have. There's also a suite of consumer protection provisions in this bill. We are going to join the vast majority of states that adhere to the simple idea that if a company is engaged in unfair practices, we should be able to do something about that. We are going to end the extreme abuses of the payday loan industry. Again, thanks to the work of Representative Cagle and Representative Katiza Watoon. This has been something that people have spent over a decade doing. It is getting done in this bill. We are going to pass a right to repair so that people have the opportunity to fix their own things. And that's a special one for me. I had a constituent that I met when I was out door knocking the first time I ran, and he had glioblastoma. It's the same cancer that killed John McCain and Ted Kennedy and thousands of other Americans every year. And he called me and told me that this was the bill he really wanted to see passed. He died 2 or 3 years ago. I'm glad that we finally are getting it done, and I'm remembering him today. It includes Representative Hemmingson-Yeager's excellent bill on genetic testing. She told me that we'll be the 7th state to protect people's genetic data. That's pretty good. I like that. It includes, Mr. Speaker, it includes your bill to get rid of minimum markups in gasoline, ending that 8-cent markup that isn't doing anyone good as a consumer basis. I wish we could have done even more, and maybe that's why our terms are 2 years, because we'll come back next year, we'll take on big tech, we'll take on big pharma, we'll take on all sorts of other things, but this is a good start.
Is there any other discussion on the motion to adopt the conference committee report on Senate File 2744? Seeing none, all those in favor of the motion to adopt the conference committee report on Senate File 2744, please say aye. Aye. Those opposed, please say no. The motion prevails. The clerk will give the bill its third reading as amended by conference.
Third reading, Senate File number 2744, as amended by conference.
Third reading is amended by conference. Discussion to Senate File 2744, its repassage as amended by conference. I recognize the member from Chisago, Representative New Brindley.
Thank you, Mr. Speaker and members. I'm not sure that any Republicans voted for this bill coming out of this chamber the first time, and I can't imagine that anyone will this time either. There are really significant problems with this bill that just haven't been fixed, and I'm going to highlight a few of those for you. I will start by just saying, this is something that, I've had private conversations with my Democrat colleagues and friends. Unfortunately, while I believe the goals of this bill are good, and I believe the intention is to decrease the cost of health care, to decrease the cost of prescription drugs, I believe that that is the goal. I believe that's the intention. I just think evidence shows us that that's not the case, that that's not what this bill will do. Let's address capping copays. I've used the example, this bill caps copays for just a few select chronic illnesses, asthma, diabetes, allergies, I believe, an EpiPen maybe, I forget what the third one is. Here's the problem though. There are a lot of people who just don't need those caps. And frankly, most insurance companies have already done those things, particularly when it comes to diabetes. But there are a lot of people who don't need this benefit. I use the example of my brother-in-law and sister-in-law. She is diabetic. He is a radiologist. I assure you they're doing fine and can afford to pay for her diabetes supplies and her insulin. They can pay for it. And here's the problem when we do these sweeping reforms that say nobody should have to pay for this. What we mean is that everyone should have to pay for this. Because by capping these costs here, somebody has to pay for that. The cost still exists. And so now we're going to say that that cost is going to be picked up by other people, even for those people who can afford it. And I'm a real fan, actually, of picking up those costs for people who can't afford it. We should do that. That is a proper function of government, in my opinion. We should be caring for those who cannot care for themselves. It's the same thing. We had this discussion with the school lunch program, right? I thought, let's up the limit. Let's make sure there is no question that kids who are struggling, families who are struggling, have that resource and that they have those meals in school. But frankly, I'm not wealthy, but my kids didn't need it. My kids didn't need it. But now everyone in the state is going to pay for me and my kids. It's unnecessary, and it is expensive. Unnecessarily expensive. And the same thing on this Prescription Drug Affordability Board. It kind of blows my mind. As I gave a litany of reasons and problems with this Prescription Drug Affordability Board, we were basically just told, well, I don't know where you get that information. And I told you, we get it from the chairman of the PDAB in another state who has told us, the chairman of the PDAB who has said publicly that the cost from the manufacturer has indeed gone down, but the cost to the consumer has gone up. That's not my data. That's not my information. I'm not making that up. That is coming from the person who is running the Prescription Drug Affordability Board. But somehow Minnesota is magic. And here, we're going to make sure that we're actually lowering costs for the consumer, which presumably is who we care about. It's who we should care about. But we're not doing that. To follow this theme, this bill very dangerously removes all of the funding from the account that pays for the Minnesota reinsurance program. To give you a little history, to go back, after Obamacare was put in place, as it turns out, contrary to, once again, the goals, and I believe the goals were good, the goals were to lower the cost of health care in the United States. But unfortunately, in the state of Minnesota, they did the opposite. And after Obamacare was implemented, costs skyrocketed all across the state of Minnesota. And in fact, it was such a problem that insurance carriers were pulling out of certain markets. It was too expensive to even be in the market. And so, as the pull ourselves up by the bootstraps Minnesotans that we are, we went to work and figured out how to help people. And we did that through reinsurance, and it has been extraordinarily successful. We did not just stabilize the insurance market, we actually lowered the cost of health insurance by 30%. 30%. As someone who has had to buy our family's health insurance on the individual market, it's expensive. It is. And to think that we could actually lower costs by 30% is extraordinary. Now, a couple of years ago, you may remember we had a significant debate in this body about reinsurance. And finally, our Democrat counterparts came to a negotiated agreement where they changed the program. They kept it. They said, okay, we'll do reinsurance, but it's not going to be as effective as it was before. And immediately with those changes, insurance rates shot up again. Immediately. And so the next year, interestingly, the Democrats got smart going into the election year, and the next year they came back and said, yeah, we better fix this. Let's bring these insurance rates down again. And so they did. And they went back to the original parameters of reinsurance and dropped those costs again. This is an extraordinarily effective program. It is a proven program. It's a program that Senator Amy Klobuchar has advocated for at the national level to fix the problem. And yet, Democrats in Minnesota are putting that at risk again. With an almost $18 billion budget surplus, you are scrounging up the change from every couch cushion you can find, and then you're charging Minnesotans another $10 billion more in taxes and fees because somehow it's not enough for you. And we're going to pillage the reinsurance fund. We're going to pillage the reinsurance fund and put that program at risk again because there is never enough money for you. There's never enough. So we're going to put reinsurance at risk, allowing those health insurance rates for Minnesota families to skyrocket again, to put them back on this roller coaster of, are the Democrats going to be willing this year to give us some relief, or are they not? Well, clearly this year, the answer is no. We're going to pillage that fund and put it at risk for the future. Let's talk about mandates. Although the mandates in this bill are interesting, they're a little unique. The mandates in this bill fall under the category of mandates for thee, but not for me. What we're doing in this bill, and you know, those of us who have served on the Commerce Committee, on health committees, we know the trick. We know how this works. What happens is that Democrats bring forward bills to make these radical changes to the health system, but then they exempt CGIP. They exempt the state programs. And here's the deal. They do that because when they don't exempt the state programs, there is a massive fiscal note because it's expensive. It's really expensive. So when you put these mandates on insurance companies, the state has to pick up that tab too. The state is picking up the tab for our Medicaid folks in the state who need that service. The state of Minnesota is on the hook for Minnesota Care for low-income people. And it's also on the hook for what we call CGIP. It's our state insurance plan. These are state employees. Frankly, it's what we as legislators receive. We are on the CGIP insurance program along with all of our other state employees. So when you put these mandates, in fact, it's always, this is your trick, this is your clue. If you see mandates being placed on insurance companies, but the state programs are exempted from those mandates, 100% of the time, state programs are exempted because it's going to cost a lot of money. We are raising the cost of health care with these mandates. We are raising the cost of health care in the state of Minnesota with these mandates. Every Minnesotan on a private insurance plan is going to pay more for their insurance. And it's not because they're getting more, but they're going to pay more. And again, you know that the tell, every time the tell is if state programs are exempted. And they are. State programs are exempted. That means, and again, with an $18 billion budget surplus, these mandates are going to be so expensive that $18 billion is not enough. $18 billion. Actually, it's not even 18. We should start calling it 28, I suppose. $30 billion. It's not enough. With the surplus and the new taxes and fees, $30 billion is not enough for the state programs to live with the same mandates that we are placing on private insurers. $30 billion. What's the percentage that we're increasing the state budget overall? 40%. 43%. A 43% increase in our state budget. It's 50-some billion now. It's going up to well over $70 billion. $72 billion. Guys, I don't know if you can wrap your brain around that. A 40% increase in our state budget. $18 billion budget surplus, $10 billion in new taxes and fees, with an additional $30 billion. We can't come up with the funding for this bill. It's still, these mandates are so onerous that we've got to exempt all of the state programs. That tells you one thing: it's expensive. It's very expensive. I talked a little bit about this prescription drug affordability board. And of course, like I said, the name suggests it's going to help Minnesotans afford their prescriptions. And the name suggests, and I believe the intent, the intent is that it's going to save Minnesotans, individuals. It's going to save me, my family, your families, your moms, your dads, your grandmas, your grandpas. It is going to save them money when they go to the pharmacy and pick up their prescription. That's the intent. That's the intention of this bill. I like that intention. That should be all of our intention. To lower the cost of prescription drugs, that is 100% what we want. That is 100% what we want. Everyone's on board. But when we're setting up this board in a way that we know right off the bat is not going to work, because, I don't know what we keep hearing this year, but there's advocates that want it. We hear that on every single bill, these mythical advocates that want things. We don't always know who those advocates are. We certainly know that on this particular issue, All they're doing, in fact, this is a habit, we like to cut and paste language, cut and paste legislation from other states. That's what this does. We're taking this Prescription Drug Affordability Board that we've seen, it's passed into law in several states. We have not seen it decrease the cost of medication in a single one of them. Not one. But instead of waiting and seeing, okay, what are the problems? Minnesota's like, nope, sign me up, let's get this done. Maybe we should wait. Maybe it would make sense to say, it's the beauty of the United States, right? It's the beauty of a republic. That we have all of these different states who are trying different things. Maybe it would be smart at some point if Minnesota Democrats thought, you know, there are some states doing this. We should see how this works out. We should see how this works out for them. Because you know what? I mean, it's like technology, right? Any first generation technology. I don't know about you guys. I'm not very good with technology. And so I always have to wait. I cannot buy first generation technology because I can't be the person that they're going to work out the bugs on. Because frankly, technology is too frustrating for me. So I can't be the person they're going to work out the bugs on. And here we have a situation with the PDAB that we have a number of states who are already doing this. And instead of waiting for them to work out the bugs, instead of looking to the states that say, you know what, we're going after the big bad pharmaceutical manufacturers, we're going after the big bad drug companies, we're doing that, and you know what? Other states have found that that is effective. The PDAB has effectively lowered the cost of prescription drugs coming from the manufacturer. It has been successful in other states on that front. But the problem is, this is a really simplistic view of a very complex problem. The drug manufacturer is one piece of this supply chain. They are one member, they are one cog in this wheel. Just one. You've got the entire supply chain. The PBMs, you've got the end user, you've got the pharmacies, you've got hospitals, you've got specialty pharmacies. There are a lot of people in this supply chain, but this PDAB goes after just one of them. The PDAB goes after manufacturers. So like I said, in other states, they have found, yes, this is effectively lowering the cost from the manufacturer. But it is raising costs. Costs have gone up for the consumer, for the end user. And I don't think that's what we want to do. I don't know why we would barrel through and say, let's do it. Let's take that language and plop it here into Minnesota. Let these experiments play out so that we can fix them and we can do them right and we can actually lower costs of prescription drugs from the Minnesotans who need it. Because there are people who need it. There are people who desperately need it. And I get it. I've talked about this a lot. With my late husband, he was on a significant cocktail of drugs, mostly treating symptoms, but a significant cocktail of drugs. And just one of those medications, it was a nebulizer treatment, just one of those medications was $600 a month. Out of pocket, that was my cost. It was $600 a month. I get it. It's expensive. Minnesotans need those costs lowered. But frankly, I could care less if we're sticking it to the manufacturer and you're sticking it to me. I could care less. Let me correct that. I could not care less if you are sticking it to the manufacturers. But then my neighbors still have to pay even more at the pharmacy. That defeats the purpose. Why are we doing things that again, this is the chairman of the PDAB, the chairman of the Prescription Drug Affordability Board. This is a direct quote from the chairman. This is not some rando person. This is not some anti-pharmaceutical company person. This is somebody who presumably wants to see these costs lowered. The chairman of the Prescription Drug Affordability Board has said that yes, this has been successful in lowering the cost from the manufacturer. But at the same time, it has increased costs for the consumer. The person at the pharmacy counter is paying more. But we're just going to do it. We're just going to do it. There's a provision in this bill regarding price gouging, which again, all of these things sound really good. Every one of these provisions sounds good, and at its face, we're all on board. We should ensure that we are not putting Minnesotans in a position, particularly at the most critical times, where they are being taken advantage of. That's a big deal. And so there's legislation in this bill to ban price gouging, and it is well intended. Again, I agree. But once again, it fails to deliver that value to customers, to the consumers, to every Minnesotan who needs that relief. And in fact, this is sort of shocking. Instead of protecting consumer, it just gives more power to the governor, because that's what we need, more power to the governor, because we've seen how well that works. It's going to lead to lawsuits. In fact, I asked Representative Niska, we need to put together an actual list and accounting of all the lawsuits that we expect to come out of this legislative session, because it's a doozy. That's going to be quite a list of all the lawsuits that we expect to come out of this legislative session. And this is just another one. We are inviting lawsuits, giving more power to the governor, more power to the executive branch of government, and we're not actually helping consumers. It's going to cost the taxpayers more money without a gain, without actually controlling prices or improving supplies. So it's been a habit. And in fact, it's not just this bill. It's not just right now in the chamber. But we have this habit of spending a lot of time just fawning over, again, preening and peacocking about how amazing this bill is and all the good it's going to do, when we just know it's not. The Democrats already tried to gut reinsurance a couple of years ago and very quickly backpedaled on that and said, ooh, it's an election year. We better bring that back. We better bring those prices back down. We better make sure that health insurance is more affordable. I'm sure all these mandates on insurance companies are just top shelf, really good. But guess what? If they were actually going to save people money, it would apply to public programs. If it was actually going to lower the cost of health care, it would apply to public programs, but it doesn't. Mandates for thee, but not for me. And ironically, when we say that, when I say mandates for thee, but not for me, I say mandates for all of you, the rest of the Minnesotans out there, but not for me, not for my plan as a legislator. These mandates don't apply to my plan as a legislator. They're not going to make my costs go up. They're not going to make my costs go up. But they are going to make your costs go up for every employer-based insurance plan in this state. That's how this works. That's how this works. When state programs are exempted, it's because it's expensive. It's because we can't afford the fiscal note. That's how this works. Folks, this is going to be an expensive bill for Minnesotans. It's going to be an expensive bill with very little gain. We're not getting much for it. And in fact, in your day-to-day life, you're not going to get really anything for it. You're not going to know that this commerce bill has passed into law. In your day-to-day life, this is going to have zero impact. There's a lot of bills, actually, there's things that we do here that have an immediate positive impact on your life. And those are the things that we should do. Those are the things that we should be focusing on as legislators. This bill isn't it. This bill isn't going to have an impact on your day-to-day life. You're not even going to know. But you might know in your pocketbook. At a time when between a surplus and taxes, we've got $30 billion to work with at the state of Minnesota in the government. At a time we are passing a budget that is 40% bigger than the previous budget, you're going to feel this in your pocketbook. You are going to feel this when you're doing your monthly budget at home. When you're writing your checks and paying your bills, you are going to feel the effects of this bill. But I suppose you can have the moral victory of knowing that, hey, those drug insurance companies or those drug manufacturers, we're sticking it to them, but oh, shoot, you're also sticking it to me. Sorry, Minnesotans. That's what you're getting from this bill.
Further discussion on the repassage of the Conference Committee report for Senate File 2744. I recognize the member from Hennepin, Representative Nadeau.
Thank you, Mr. Speaker. Would Chair Stephenson yield to a question?
Chair Stephenson will yield to a question. Representative Nadeau.
Thank you, Mr. Chair. Chair Stephenson, if you would look at line number 61.12. This is talking about standard plans. I don't recall this bill being heard, at least it wasn't heard in health. And if I'm not mistaken, this is just putting a federal requirement into state law, where we already have this option regarding standard plans. But could you just speak to that and tell me if that's what that's doing and what problem we're solving by adding that into the bill?
I recognize the member from Anoka, Representative Stephenson.
Thank you, Mr. Speaker. Thank you, Representative Nadeau. The sections related to the standardization of plans come from the governor's budget proposal, and you are correct that it is reorganizing existing law and applying federal law to Minnesota. You are correct.
Representative Nadeau.
Thank you, Mr. Speaker. I wish I was more dramatic, and I could speak, a little bit louder and more like my friend Representative New Brindley on this bill. But I'm not. That's not who I am. There are some good things in this bill. There really are. I'm glad to see that Representative Freiberg worked with all parties on the infusion clinical administered drugs component of this. I think he made some good headway. I like the headway that Representative Bierman made with some of the benefit reimbursements delivered through the collaborative care model. I think there's some good things in here. But there's also some really tough things in here. And Representative New Brindley, really hit it on the head. When we're talking about the Prescription Drug Affordability Board, we had this debate. I'm not going to rehash it. These are unproven policies that we're putting in place that hopefully, I'm hopeful that Chair Stephenson is right. The first time I heard the bill, I asked, bring me through the sequence of events. How does this deliver lower cost to consumers? And we're still waiting to hear that. This bill is a lot of, it's bigger government, it's more government. I recognize that side of the aisle, really believes that government can play a more important role in driving down those costs. In healthcare, it just doesn't happen that way. I wish we'd have had the debate on the health bill before this came up. I think it would have been easier for me. I think it would have been a lot easier for me to do it. We have this body, and especially this bill, once again, it focuses on one half of the component of healthcare delivery, and it's access. It's access. We have bent over backwards, spent multiple millions, hundreds of millions of dollars, creating more access for more people to get care, which is great. There's nobody over here that doesn't believe in that. But the other half is affordability. And I get it that it's written in here, the word's in here, but the people that actually have the ability to help deliver affordable care are basically saying, this is not how we do this. And those are the partners that when I mentioned Representative Freiberg, Representative Bierman, they're listening to those bodies, to those people, to those communities that are saying, we've got to change this. So there's a lot in here. Representative New Brindley is absolutely right. There's not one thing in here that's going to drive down consumer costs on prescription drugs to consumers. There's nothing. It is the most, I wish we would have started maybe with rebates. If we would have started with drug rebates, I think we could have actually, done something. But we didn't start there. And so with that, I'm sorry. This bill is not, I get it, it's going to pass. I wish it weren't. I wish we'd think harder about these things. But I'm a no vote on this bill. Thank you, Mr. Speaker.
Further discussion on the repassage of the Conference Committee report for Senate File 2744. I recognize the member from Carver, Representative Nash.
Thank you, Mr. Speaker. Well, if you remember when we had this bill on the floor here during the Hell Week that we had, I mentioned the digital repair, and I likened it to the TV show, the Andy Griffith Show, and I don't know how many of you remember who I referenced as the character, but it was Emmett Clark, the guy with the fix-it shop on Main Street, Mayberry, who you would bring your toaster to, or maybe your blender. You might bring other small, maybe your TV back in the day. And I think those are the things that make sense when we talk about being able to repair them. And Representative Fisher doesn't seem to be on the floor, but I will give him credit for listening and trying to help bring some changes to the bill that would sort of mollify some of the concerns of the manufacturers of technological equipment. But I wanted to point out something that the chair said in his introduction, that he was hoping to either in this bill or one day hold big tech accountable. What happens in this bill is manufacturers of machines that, Representative Bliss, you might know a little bit about this in your IT days. We don't necessarily want to hand over the full keys of the kingdom on certain types of equipment, because when you do that, you make it easier for bad actors to compromise things. And that's costly, dangerous, expensive, and some of the practical upshots of those things are if a person who is intending to repair some piece of enterprise technology gets access to certain things, they know how to defeat them. You could do things like you could defeat grids, electrical grids, you could defeat certain systems at hospitals or schools or security systems at any of these places. And there's a reason that large technology manufacturers try to keep things close to the vest, because it's, one, proprietary information, but two, when you, again, hand these things over to people who are not certified technologists, some could literally be hanging out a shingle outside of their garage or their mom or dad's garage. they are not properly trained. And the manufacturer doesn't have control over what's going on when they are handed this perhaps an enterprise piece of technology. That's concerning. We have brought that again and again and again to people, and I think that the concerns are really quite pronounced. You've all had letters. I think I passed out last time a letter of concern from Cisco. I know that there are many technology manufacturers who are quite concerned with this bill. The concern should also transport to you, because this is your bill, this is your decision. You're likely to be the only side to put up votes for this. I don't believe anybody from our side is going to do so. But let's make it even closer to home. One of the many hospitals that you may have in your area could be compromised with technology that you're going to forcibly hand over to people who may purport to be interested in repairing things, but they may themselves be bad actors trying to get access to things that they can then compromise and take down a system. So that's on you. So many of the hospitals that we talked about with Representative Brandt's bill a little while ago, or actually it was Representative Bierman, sorry, Representative Brandt, they're going to be seeing many challenges. You're now going to make it perhaps even more expensive for them. Used to serve on the hospital board. I know that technology investments are significant, but if you immediately hand over some of the access to what they're trying to protect their systems with to who knows who, you're going to put them in a very uncomfortable position. You're going to wind up having to have greater and more security contracts go out there. I think that it's certainly a nice idea to want to be Emmett in Mayberry RFD. Certainly we'd love for someone to be able to fix their toaster or their lawnmower or whatever. But when you get to the level of enterprise tech, and I think I shared this story during the debate. So there's a well-known company in China called Huawei, and they will actually buy enterprise technology here in the US from one of the other vendors, and they'll ship it over to China, and they will very quickly copy it and take pieces and parts out of it, and they have been caught doing so. But because they are effectively the Chinese government's technology company, the Chinese don't care. But we are now going to make it even easier for them. They won't even necessarily have to break open a machine. You're going to require that they be given all the specs, tech, and keys to the kingdom. That should deeply concern all of you. But by the fact that no one over there is listening to me, you're all looking at your phones and such, I can tell that you don't care. And that's even more concerning, because when some of this eventually forensically leads back to compromises as a result of this change, then you'll care. Then you're going to care, and you'll say, well, self, that was a bad idea. That was a really awful idea. You know, so many of us have people in our lives that depend on technology being in place. Here's an example for you. The 911 system, both what it's based on now and what it will become, is predicated on having a fixed latitude and longitude being able to be pushed back to first responders. We'll have a little nerd moment here. Currently, it is based on what's called a Tiger file. It's a topographically integrated, geographically encoded record. That means the piece of tech will have to be able to interface with a latitude and longitude and then direct EMS service to you or police service to you. But if you then hand over the keys of the kingdom, and this is not a prop since it's my phone, but if you hand over the keys of the kingdom to an iPhone or other phones, you're now going to make it even easier to potentially compromise that. And if we were to see a great deal of bad actors try to take that down and then not be able to respond to emergencies, well, none of our EMS people are here, but you could have a call, and so I'll just pick on Representative Quam since he's looking at me. Someone picks up the phone at Representative Quam's house, dials 911, and they get sent to Representative Mueller's house. They're not even close. That's the sort of practical upshot that you all are making even easier in the passage of this bill. Once again, this is not a toaster. And you all may have believed all the propaganda you've been given that this is a great bill, this is a transformational bill, this is lovely, everyone's going to love this, it will change your life. Yes, it could change your life for the worse when you hand over proprietary tech kind of at gunpoint. You're making them turn this over. That's troublesome. I will not be affixing my green vote to this bill. I encourage members to not also affix a green vote to this bill. Vote red on this bill. This is not a toaster. Thank you.
Further discussion. I recognize the member from Olmsted, Representative Hicks.
Thank you so much, Mr. Speaker. I am so excited to push the green button for this bill today. Some people in this chamber know, not everybody, my youngest daughter has a rare health condition called mast cell activation syndrome. She had her first anaphylaxis reaction when she was 11 months old. Since then, she has subsequently had 24 anaphylaxis reactions. She's been in pediatric ICU, hooked up to epinephrine, which I've been told is not typical nor great medical practice, but it was the only thing to keep her on the planet. I buy EpiPens in packs of 6. She's a rebounder, so when she reacts, we're gonna need 2, maybe 3, depends on how long it takes us to get to the hospital. We don't vacation anywhere that's not 3 hours close to a PICU, because after she has 3, we have heart issues, so we need to be somewhere where they can intubate her. This is the life of an allergy parent. And when I had commercial employer insurance through my nonprofit, which was a great company to work for, and they gave us the best insurance they could, I stood at pharmacy counters where people said, "That will be $500, please," to keep a 1-year-old on the planet. We weren't rich, we didn't have $500. That was, back then, half our mortgage. This bill changes that. This bill ensures that children who are allergic to bee stings and dairy and nuts and strawberries and watermelon can go out into the world and their parents don't have to worry that they will die because they couldn't afford their EpiPen. So today, for all the allergy moms, I say thank you. We appreciate it, and it is life-changing for us.
Further discussion on repassage of Senate File 2744 as amended by conference. I recognize the member from Isanti, Representative Dowd.
Thank you, Mr. Speaker and members. Appreciate the opportunity to talk about the Commerce Omnibus Bill. We had a good discussion when it left the floor. The bill is not much different. I'm actually fairly disappointed in that. I think there were some things that really needed to be fixed and changed in that bill. And I think we just missed the mark on that. A couple of those that I want to talk about. Number one is the reinsurance provision. Reinsurance has been an incredibly successful product here in the state of Minnesota, and has helped keep the rates stable in the individual marketplace. As you might remember, the disastrous implementation of Obamacare here in Minnesota and the disaster that it was for Minnesotans with the skyrocketing deductibles and basically, technically I think you could say that there are more people insured, but by no measure of any metric that we actually track would you actually with a straight face say that more people are insured. There's far less people that have reasonable, affordable coverage in this state as a result of Obamacare. For years we were seeing increasing premiums in the individual marketplace that were hurting Minnesota families. We heard many stories of people who, had a family of 4. I remember one particular family that I've actually gotten to know quite well since then. I didn't know them at the time at all. We just stumbled across them at a little town hall meeting that we did down in Red Wing, I think. And this was a family of 4. And I actually heard this story repeated multiple times since. Very similar stories by families who were seeing the same kind of increases. But this particular family, as a result of Obamacare, saw that they were a small family farm, family of four. They were paying $13,000 for their deductible before they ever got one penny of coverage, and their premium was about, if I remember right, $3,800 a month or $3,600 a month, something like that. I mean, we're talking $50,000 out of pocket before you have one, with the premiums and the deductible, before you have one penny of coverage for your family. I mean, that's the disaster that Obamacare is, and has been here in the state of Minnesota for Minnesotans. It's really been disastrous by every stretch of or metric that we would measure here in the state. It's really been disastrous for Minnesotans. And the reason for that is simple. In Minnesota, we actually did it better than all the other states. So when you set a mean bar across the country and say, okay, we want the level of health insurance and health coverage to be here, when you're above that bar, you end up coming down, and that's what happened. So what we should have done was we should have exported what we had here in Minnesota to Washington, D.C., instead of taking those bad ideas and bringing them here. Well, we won the majority back in 2014, and one of the things that we implemented was a reinsurance program. And the reason it was needed is because we saw those premiums just every year when it came time to bid in that individual marketplace. The low bidder from the previous year would always drop out completely. They would just leave the individual marketplace. So every year there was one less provider, and then the next year the low bidder would provide coverage for 1 year, and then they would drop out the next year. They wouldn't even provide coverage in the individual marketplace. So, and then every year the premiums would go up. And I can't remember the numbers now, but I want to say we were seeing like 30 and 40 and 50% increases each year in those premiums. Just absolutely unsustainable and absolutely unaffordable. And the evidence of that really was that our hospitals, they use, I think commonly on this House floor we use another term which I don't like, so I'm not even going to say it. But the more technical term that the hospitals would use is uncompensated care. So in uncompensated care, that's basically people who receive services but don't pay their bill. And after Obamacare was implemented here in Minnesota, the level of uncompensated care was actually higher after it was implemented. And which seems kind of shocking, right? Because technically we could say that more people were insured under Obamacare. But the reality was, because they had a $13,000 deductible now instead of a $1,000 deductible, they couldn't afford to pay their deductible. So they couldn't pay their bill at the hospital. And so hospitals actually had a higher level of uncompensated care after Obamacare came to the state because of those high deductibles. So people were not able to pay their bills. And in essence, I would say those people then were not insured. So what we did, because of those kind of skyrocketing premiums as a result of Obamacare, and the fact that we had an insurer, that the low bidder insurer each year was leaving the marketplace, we put in place this kind of creative solution, which is actually very similar to the MSHA program from our previous, prior to Obamacare, the way we did healthcare here in Minnesota. But basically it was a reinsurance program where the state would cover the most expensive claims so that the insurance companies could price their product and know that they weren't going to have to pay claims above a certain amount. So we would take the really, I'm talking about the really egregious stuff, right? The cancer treatments and the very expensive treatments that somebody might have. And I think the problem too with the individual marketplace after Obamacare came to Minnesota was that the number of people that were in that individual marketplace was probably 20%, something like that. I don't remember the numbers right off the top of my head, but probably 20% of what was promised here on the House floor and what was predicted by those who were, advocating to implement Obamacare here in the state. So had we actually had those higher numbers, I think that the whole program probably would have played out a lot better. But folks left the individual marketplace because they couldn't afford the products. They couldn't afford the deductible, and they couldn't afford the premiums. And so what we did is we put this reinsurance program in place, and it was so successful, it became a national model. And I think since we did it, I think 12 or 13 other states have implemented that and have done it very successfully. So we became a nation leader, which we were actually before Obamacare, but we once again, after the debacle and catastrophe that Obamacare was, we kind of, at least in that individual marketplace, because of reinsurance, became kind of a national leader in solving one of the problems that Obamacare created. So we actually, again, in what we should do more of, is exported our good ideas to other parts of the country. Don't get me wrong. I'm not talking about the ideas here in this session that we should be exporting. We should not wish that on anyone in this country. But prior, I think we've got a good example that we can talk about in this bill. So we went through about 5 years, I think, of reinsurance. It was very successful. We actually saw an actual reduction in premiums of, I think the number is 36%. So premiums came down more than 1/3 just as a result of that. And I think, that's the sort of success that we should celebrate here in the state. So over the last couple of years, the reinsurance program was reauthorized, and it was funded for, I don't remember if it was 2 years or 3 years, but actually that funding that we gave it, because of the predictions, it actually was enough to operate the program for probably 4 or 5 years. And I think by the time we got there, the 5-year operation would have been, we would have been able to operate the program for the full reauthorization for the full 5 years that it was reauthorized. Unfortunately, this bill and this committee received a target from leadership that was a negative target. And there was no way to reach that target. It was a negative, I don't know, it's probably in my paperwork here, 260 million maybe. And the only way to get that money out of this bill was to take the money out of the reinsurance program that had been authorized for that program and transfer it now into the general fund to use for other things. That's what the targets, and that's what this bill does. We made a motion, obviously, to stop that transfer and leave this money. And the great part of what I get to say next is that I'm not imagining what could happen. It's not a hypothesis. I'll tell you exactly what's going to happen. Insurance premiums for Minnesotans who are in the individual marketplace as a result of this bill will go up at least 36%. We know that because that's the history, and we have enough of a track record now to know when we fund the reinsurance program where premiums are, and when we don't fund it, we know where they are. And consistently, Democrats in Minnesota have tried to defund this program. And of course, because of our House rules, I can't speculate as to why they might want to do that. I think people outside this building might say or speculate that Democrats want the individual marketplace to fail. Now, I don't want anybody to really speculate on that. I don't think it's appropriate for us to do that. But I think that this bill could give people the idea that Democrats want the individual marketplace to collapse on itself so that they could put in place a single payer. Lately, I love how the language changes, right? And we try to find words that sound really great. What they call it now is the public option. The problem with the public option is there's no private option. It just becomes a single payer system. So I'm gonna actually use the term single payer because that's what it is. And what that means is government run healthcare. That means government will just pay for all the procedures for everyone. And we know what that means in other parts of the world. The parts of the world that have that sort of a healthcare system right now, they're all moving away from that. Other states that have tried to do a single payer system I said this during the initial speech, and I should have looked it up. It was Connecticut, Massachusetts, somebody in the Northeast got into this far enough that they were going to put in place a single payer system until they saw the numbers. In the legislature, we call that seeing the fiscal note on what something like this is going to cost. And they got far enough into it that they saw the fiscal note and the fiscal cost, and they realized, whoa, we better back out of this, because there's absolutely no way that we could ever afford to do this. And the problem is, you take away all of the incentives that are created by a free marketplace. And I want to say that and use those words because that's important consistently across the board to what Democrats are doing this session. They're removing the incentives that created by a free marketplace, and what they are doing in return is incentivizing bad behavior. So in the healthcare marketplace, what that means is you're going to incentivize people to go to the doctor in the hospital for anything that they have, including a little cough or a runny nose, and that clogs up our healthcare system to the point where people that need to access healthcare can't get in for months and months on end. And then you've got the government rationing healthcare and deciding, you know what, you're 73 years old, you've lived a good life, we don't think you deserve a hip replacement, or we don't think you deserve a knee replacement. You know what, I think I'd like to, I don't know, maybe I'll borrow a term that I've heard used in this chamber before. I actually think that's a decision that should be made between a patient and a doctor, not some government health board that decides rationing healthcare is the only thing that we can do now. And somebody in the government gets to decide whether my dad gets a knee or a hip replacement. No, thank you. I don't want the government making those decisions. So we put in place the reinsurance program. We did that for very good reasons. It has been incredibly successful by every measure. And so it was so successful that Democrats in this chamber reauthorized it in the last couple of years, and they funded it for 3 years, which ultimately would, if we leave the money in that account, it would fund it for the entire 5 years. Maybe we have to check on it in 4 years and just make sure there's enough money there for the 5th year, but I'm pretty sure it would actually fund it for the 5 years. And that's the track record of how successful this program has been. And it actually, premiums are still too high because we still have the effects of Obamacare, but this actually did a lot to keep them lower, and it's been incredibly successful. So I really want to thank Democrats for their past support of reinsurance and their past understanding of how important that program is and what it did for Minnesotans. Unfortunately, I'm disappointed that they have forgotten that already. You were the ones that reauthorized it. You were the ones that put this money in and funded it, and now you're stealing money from it. And stealing money is a word we like to use around here when somebody sees a little pot of money sitting as a surplus in a fund that they realize, I could actually take this and use it for something else that I want to do. And the problem with that is it will hurt Minnesotans, period. It will raise insurance premiums for Minnesotans by at least 36%, period. Those are not in question. Those are facts. So the stupidity of taking this money is only amplified amplified. It's only amplified when you look at the current environment that we're in right now, where we have a $17.5 billion surplus, and greedy Democrats are going to raise another $9.5 billion in taxes. And on top of that, they have to steal $260 million from Minnesotans who are struggling to pay for their health insurance. I mean, that's the environment that we're in on this bill right now. It's just absolutely insane that in this environment where we've got more than double, the biggest surplus we've ever had in state history, and on top of that, Democrats can't, they're outside groups asking for so much funding for every little program they've ever dreamt of, and Democrats' absolute inability to say no ever to one of their special interest groups. Now we've got Democrats stuck in this, between a rock and a hard place, where they actually have to raise taxes another $9.5 billion on top of the $17.5 billion surplus we have. Total of $27 billion of resources available. And you know what we need to do? In that environment, and just so you know, our budget is what, $52 billion? And we've got an extra $27 billion of resources available? And what do we have to do? We have to steal $260 million from Minnesotans who are struggling to pay for health insurance. I wish I was making this stuff up. Do you know what? I'm super creative. I couldn't have even thought of this. In a million years, I couldn't have thought of this. But that's where we are. And I hope there's just, what do I need? 3 members over there? 3 members over there to say, you know what? Isn't this just going a little bit too far? So I'm hoping that I can persuade 3 members of the Democrat caucus to just say, you know what, maybe when we have $27 billion of resources on top of the base spending of spending in the current biennium I think is $52 billion. The base is already increased from that, and on top of that, another $27 billion of resources available. I mean, it's crazy town. And we got to steal $260 million, whatever the number is, $270 million from Minnesotans who can't afford their health insurance. We cannot do that. This is stupid. And we talked about it before the bill went out of the House to conference committee. I was fairly convinced that folks would have some moment of clarity in conference committee and realize, you know what, maybe we are overtaxing Minnesotans. Everybody outside of this building can see that. And everybody on this side of the aisle can see that. But I actually think you guys are so stuck in a fog that you have failed to actually sit down and look at what you're doing. Just put it on a piece of paper. Put down what the base spending was the current spending this biennium. Then put what the forecasted base is going to be. And then add on top of that the surplus, and then add on top of that your tax increases, and then add on top of that all these little pots of money that you're stealing from in all of these bills. It's crazy. You have no business being here if this is how you manage funds. And none of this is political. Stop trying to shove your ideology down Minnesotans' throats. Let's think back to when you were on the campaign trail and what Minnesotans were most concerned about in this state. The biggest things that Minnesotans care about, inflation. We have record inflation. You made promises to give them their Social Security tax, or not tax their Social Security. Let them keep it. Broken promise. The highest inflation in a lifetime. Crime rates skyrocketing, and you bring a public safety bill that's actually going to keep make Minnesota less safe. But we're funding a whole bunch of nonprofits that we are not holding accountable at all. They're not doing anything, and frankly, there's no accountability. You don't even ask them to fill out a report to tell us what they did. You just give them money. There's no oversight of the fraud, the waste, and abuse in all of these programs, the Feeding Our Future. I understand there's another huge fraud coming. I got a little tip. I don't know much more about it than it's in that DHS or Health and Human Services. I think it might be in the home-based services, but I understand that it's a fraud that is greater than $100 million. I heard about it a month ago. And I kept thinking, any day now, any day now, any day now. If I find out that you knew about it when it comes out, or that our governor knew about it and kept it hidden from Minnesotans while you snuck your way through a legislative session, stealing $27 billion from Minnesotans in addition to, the money that they've already given you, I would put that at the highest level of no shame that I've ever seen. So pay attention, mark this spot, mark this day on your calendar, because I'm sure I'm not the first person around here who has told you there's another big fraud coming, north of $100 million of fraud. And I still can't believe it hasn't totally been released yet. But I have it on a good source that there's a pretty significant fraud in addition to the fraud that we've already seen. And no accountability. No holding anybody accountable from the Feeding Our Future fraud. And nothing to correct that, to make sure it doesn't happen again. So, members, this bill, because of this reinsurance provision, absolutely cannot go out of this chamber. This is the point where you need to say, you know what? Your common sense needs to take over, and you need to say, no, we're not going to do it. We're not going to take more money. We're not going to steal more money from Minnesotans. And so this is your opportunity to do that. I thought we made a good case when this bill was here the first time before it went to conference committee. I thought for sure you were going to fix some of this stuff in conference. The bill comes back. It looks almost identical to what went out of here. And I can't tell you how shocked I am, because this is really bad legislation, really bad public policy. And that brings me to my next point in this bill, which is the boat bill. You know, thankfully, we live in a state with no lakes and nobody that owns a boat. So this will affect no Minnesotans, right? Oh, wait, no. We have 15,000 lakes, and I don't even know how many boats. Hundreds of thousands of boats in this state. And boat insurance is not required in the state of Minnesota. But we're going to do something in this bill that hasn't been done in any other state in the country. And I wish it was the first time I was saying that this session. But there's a whole bunch of groundbreaking territory in these bills. And when you're doing something for the first time that nobody else has done, there's probably a reason for that. It's probably a really bad idea. And I assure you that you're not creative enough to think of things that nobody else has ever thought of. It's just that those other people had a threshold of common sense where they realized, yeah, we looked into it and realized this is just really a bad idea. You know, and maybe it's not that big of a deal for a state like Arizona or, you know, Oklahoma. But in Minnesota, we do have 15,000 lakes in this state. More boats per capita than anywhere else in the country here in Minnesota. So, to my point, 7%, what is the first part of that? 7% of registered boats in the United States are here in Minnesota, and we have 809,000 registered boats. So 7% of all the boats in the country are right here in Minnesota. Folks, that includes both coasts. So we've got 7% here in Minnesota, and that's 809,000 boats. Now, I'm going to warn you, boat insurance is not required in the state of Minnesota. And that's going to be I'm saying that poignantly because it's going to be very important as we proceed through this conversation. 809,000 boats in the state of Minnesota, and insurance on a boat is not required. Not even liability insurance, okay? Like it is on your automobile, right? You have to have insurance on your automobile, and that insurance is not only to protect you, but it's to protect the other people if you're in an accident. So that if you know you're in an accident with somebody, you have, and I'm not an expert on insurance, but if they don't have insurance, you have insurance on your car that will cover you, and then you have a uninsured motorist provision that kicks in as well. But insurance is required by law in the state of Minnesota. So, and it's to protect you and to protect the other people, okay? 809,000 boats, 7% of all the boats in the country, right here in Minnesota. And this bill would, for the first time anywhere in this country, allow a husband to sue a wife or vice versa or a family member. And the reason this is so bad is because you now have two parties which have I think what lawyers would define as a shared financial future, who can sue each other, or one can sue the other and sue their insurance company and have a shared financial future. So the person who is in court, who the insurance company is defending, sleeps at night and rides to court with the person who is suing them. So how do you think those depositions are going to go? And I'm not suggesting, and I know that we had a long conversation about this on the House floor the first time this bill went out, and we talked about the potential for fraud. I'm not suggesting that somebody is going to create a boat accident or cause one with the idea of committing fraud. What I'm suggesting is that a real accident could happen, or I'll still call it an accident, but an accident where there is some level of where the person does something wrong. The driver of the boat does something wrong, and they are at fault. And now you've got their spouse who can sue their spouse who was at fault for an injury or something, and those two people live in a home together, share bank accounts, share a financial future, which means that the person who was at fault benefits from the spouse suing them. There is a big reason why this isn't done anywhere in the country, because it invites fraud. And I'm not suggesting somebody's going to create a boat accident or cause one just for the purpose of fraud. I'm suggesting that an accident can happen where the spouse is actually at fault and somebody else who has a shared financial future in that family is injured. Now they can sue the spouse and both spouses benefit. So do you think that the spouse who was at fault is going to be a good witness on behalf of that insurance company? Or now all of a sudden does the insurance company have two witnesses working against them? And could it be in their best interest to maybe cover up the fact that there was some behavior that was at fault by the one spouse? And maybe they'd say, no, I wasn't speeding, or no, I wasn't drinking, or no, I wasn't, doing any of those things. This was just a freak accident, and the insurance company should write us all a big check. Even though the spouse may have been drinking, and the spouse may have been operating the boat in a manner that is unsafe, a reckless manner. And now that spouse who did that can benefit by the other spouse suing them. And that's exactly the sort of fraud that this bill will invite. But what are the practical implications of that? The practical implication of this is it will undoubtedly increase insurance premiums for boats in the state of Minnesota. That is without question. It's only a matter of how much will boat premiums increase. Will they increase 50%, 100%? I think that's very likely, and it could be north of doubling. 100% increase would be a doubling of your boat premium. I think it's very realistic to assume that's a realistic possibility, that they could double. Could be more than double. I think it's also very fair and very realistic to say that boat insurers, people who insure boats, will likely stop offering that product in the state of Minnesota because they won't want to. There's no way to imagine how much this provision could cost them in increased losses. Okay? So they have to try to actuarially price their product, and there's no way to predict how much that is going to cost. So I think you will very realistically have insurers leaving the marketplace. So what does that mean? That means you've got a state that has more boats than any other state in the country. 7% of all registered boats here in Minnesota. We all love to get out on our 15,000 lakes across the state and enjoy the rich tradition of water sports in our summers here in Minnesota. We love it. And people are going to think they're going to be out there and be protected in case something happens. Well, certainly the operator of that boat has insurance, and I will be covered, and I will have access to the limits of that policy if I am injured and that driver of that boat is at fault. So what does it mean when premiums double or if insurance companies leave in a state where we don't require insurance on a boat? It means that some people will stop carrying coverage on their boat. The only requirement left might be if you have a loan on your boat and your bank says, I want to make sure that we have full coverage on the hull of that boat. Meaning if it's damaged, our asset, which is the collateral on the loan that you've gotten from us, that asset, that collateral is protected. Okay, so that may be the only reason anybody carries boat insurance in the state of Minnesota anymore. So what this provision will do is it will increase boat premiums, likely 50 or 100%, and it will mean there will be less access to insurance coverage in the marketplace because we have less insurers in the state insuring boats. But the real problem is it means we will have less boats covered and thereby more risk for Minnesotans who are participating in our water sports in our beautiful summers here on our lakes in Minnesota. So this is a real problem. I don't ever want to be the guy that says, I told you so, but these provisions will be catastrophic to Minnesotans who are going to be out on the lakes in the summertime, and some boater does something wrong and injures them, and they will not have access to the limits of that insurance policy because that insurance policy won't exist. We will have uninsured boaters, more uninsured boaters on our lakes because of this, and less protection for Minnesotans who are hurt. So this isn't a consumer protection bill at all. This is a fraud bill. This is a bill that allows for fraud and will actually result in less protection for consumers. Okay? And I know the groups who want this bill passed. I'm not going to pick on them, but I think we all can figure out who's going to benefit when you can have more cases in court and lawsuits between two spouses with potentially very high judgments. I think you all know who's going to get a cut of those judgments. So it's wrong, members. It's wrong. And I will tell you, I'm going to fess up and be honest with you. When this bill first was proposed here, I supported it. I was sympathetic to it. I was a supporter. And then I dug into it, and I realized, oh, wait a second. There's a very good reason why nobody in the country does this. Because it's ripe for fraud. And the real practical applications of this is this provision will also hurt Minnesotans. This is a bill that will remove protections from consumers in the state of Minnesota. This isn't a consumer protection bill. This will remove protections from consumers because we will have less boats insured as a result of this provision. And that's not something that I could ever support leaving this House chamber. So members, as you're considering your votes on this bill, I've just given you two very big reasons why I think no one in this chamber can vote for this bill. No one should, and I don't think anyone can vote for this bill. If you do, you are turning a blind eye to Minnesotans. On the first count, we have the reinsurance program that you literally in this bill are stealing $260 million from Minnesotans who are already struggling to pay for their health insurance. You're stealing money from them, and it will result at least, and this is factual, I'm not guessing, I'm not throwing darts at a dartboard, because of past history, the rates and premiums will go up at least 36% for Minnesotans in the individual marketplace. That is wrong. At a time when we have a surplus of $17.5 billion, which is actually 19 before you artificially reduced it, but $17.5 billion surplus, and you have to steal money and cause people's insurance premiums to go up. Shame on you, that is wrong, period. And the second reason why nobody can vote for this bill is because you are actually removing protections from consumers in this bill who participate just now. I mean, look at the beautiful weather outside. It's spring. People are just now thinking about getting out on the lakes and enjoying our summers here in Minnesota. And you, by voting for this bill, will put them at risk. You will leave them unprotected, and there will be catastrophic harm, life-changing injuries done to Minnesotans, and you will remove any protection they will have to get reimbursed for those injuries, because we will have less voters in the state of Minnesota who will have liability coverage to help in the case there's an unforeseen tragic accident on one of our lakes. So those are just two reasons why no one in this chamber, in a good conscience, can vote for this bill. So for that reason, I'm sure that I've convinced more than three, because I have to assume that there are at least three people on the other side of the aisle with common sense. So, or you can prove me wrong. You can lockstep, follow the party bosses, right off the gangplank, and steal money from Minnesotans, raise their health insurance premiums, and put them at risk as they enjoy our summers on our lakes here in Minnesota. Or you can prove to me that there's at least three of you that have common sense enough to say, you know what, enough is enough. At this time of the highest inflation in our lifetimes, it maybe just isn't appropriate to take this much money from Minnesotans. In a Commerce Department omnibus bill, it's maybe just not right that we pass a provision that will remove consumer protections from Minnesotans, that will result in more Minnesotans being at risk of not being compensated if they're in a tragic accident out on our lakes in our Minnesota summers. So, members, please show that the little part of my heart that still has some warmth in it, that believes there are at least three people on the other side of the aisle that have any shred of common sense left in their bodies. Please prove to me that that little candle that's still burning in that back dark part of my heart is right, and that I sense that there are at least three of you that have enough common sense to vote against this bill. So members, thank you for letting me share my concerns about this bill and about the catastrophe that will be caused if we do pass it, about these horrific provisions that we should not even be considering here in this chamber, especially at a time when there's so much bigger problems we need to solve. So I appreciate your letting me just talk about it for a little bit and share some personal heartfelt stories about folks that have in the past been harmed by these bad Democrat policies, and just to try to provide you with a little sense of what the future might look like if you blindly pass this sort of a bill and it becomes law here in the state of Minnesota. So I'd ask all members, finally, before I sit down, please vote against this. It is the right thing to do. Please show me that a bill like this is not partisan. Please show me that a bill like this can go out of this chamber and not be a straight party line vote. Please, you were the ones that funded reinsurance. You were the ones that reauthorized it just a year or two ago. You funded it. You put the money in there because you must have thought it needed to be there. You must have been convinced that the program was worthwhile. Please show me that you haven't changed your mind that quickly, and that this isn't just an opportune pot of money that you can steal from. These are real people who have real insurance policies who will see real at least 36% increases if you pass this bill. You will hurt Minnesotans if you pass this bill, period. Not debatable. You will hurt Minnesotans if you pass this bill. Please show me that you have some faith left in humanity. Please vote against this bill.
Further discussion on the repassage of Senate File 2744 is amended by conference. I recognize the member from Anoka, Representative Niska.
Thank you, Mr. Speaker and members. And Representative Dowd, you're completely correct. This bill in its final form is really more of a stimulus to the legal industry than anything else. And I'm a lawyer, and I have friends who are lawyers, and lawyers have families to feed. So I understand that. But that's not really what our focus should be in passing this bill. And of course, we are all for common sense consumer protection. And Chair Stephenson, I did appreciate a lot of the discussions we did have in the Commerce Committee this year about really carefully trying to balance some issues and looking at some things. And there were some common sense consumer protection things we looked at that I think that had broad support. And that's our job as the legislature, as the people who make laws for the people of Minnesota. It is our job to look very closely and carefully at those issues and to try to make sure we strike the right balance on each one of those issues. But I wanted to just talk specifically about one particular provision here where I think we're not just failing to do that, but really abdicating our responsibility to do that in the future. And that is the unfair and unconscionable acts and practices provision. And the main definition here is on page 179, starting in line 22. And this ties into two other existing statutes. And what it does is it creates both authority for the Attorney General under this nebulous concept of an unfair, unconscionable acts or practices, as well as creating private rights of action for enterprising plaintiffs' attorneys to go find things that are unfair and unconscionable acts and practices. And the definition here, the language we're using, is really very problematic. And we need to understand that what we're doing is we're, instead of ourselves defining as a legislature what are consumer protection violations and what are not, we're just giving the Attorney General, we're giving plaintiffs' lawyers, and ultimately giving the courts the power to make those policy decisions that should be our ultimate responsibility as the elected representatives of our constituents, of the people of Minnesota. So I think it's worth talking a little bit about this definition. It defines this concept of unfair or unconscionable acts or practices as any method of competition, act, or practice that, one, offends public policy as established by the statutes, rules, or common law of Minnesota. Now, it's very important that we look at that entire sentence. It's not violates the statutes, rules, or common law of Minnesota. It offends public policy as established by the statutes, rules, or common law of Minnesota. The violations of the statutes, rules, and common law of Minnesota, those are already against the law. So what we're doing is we're telling the Attorney General, private plaintiffs' lawyers, and ultimately the courts to look at the statutes, rules, and common law of Minnesota and maybe look at the emanations from the penumbras of those things and think about what offends public policy. So that's bad. That's pretty bad. That's not good drafting. But it gets better. 2, is unethical, oppressive, or unscrupulous. Those are not words that are defined in Minnesota statute. Unethical, oppressive, or unscrupulous. I think there are a lot of things that people do that are unethical or unscrupulous that we don't ban under Minnesota law, or is substantially injurious to consumers. So this is horrible legislative drafting. Horrible legislative drafting. And we had a hearing about this, and I understand this is a big priority for the Attorney General's office. If I was the Attorney General and wanted to just maximize the power in the Attorney General's office, first of all, I'd be really thankful for what we've done so far this legislative session already, but I would really want a really horribly drafted bill like this to just throw open the doors for me to decide consumer protection law in the state of Minnesota, to take the policy-making authority away from the people of Minnesota. So I understand that this is a priority of the Attorney General's office. But what the Attorney General's office assured us in the hearing on this, and you can go back and watch the hearing, is don't worry about these horrible vague words that we're writing into statute, because other jurisdictions have also used similarly vague words, and their courts have had cases where they have had to interpret those vague words, and don't worry, they've tightened them up. But again, our job is to make the law. Our job is to balance those interests. And we did a good job on some issues in the Commerce Committee, and I hope we will again, on many of these issues, usurious lending, consumer disclosure, those kinds of things, antitrust. We deal with those issues all the time, but ultimately we are the ones who answer to the people of Minnesota. We should not be delegating our power in the way that this is doing to the Attorney General, to private plaintiffs' lawyers, and to the courts to make that consumer protection law in Minnesota. So for that reason, again, this bill is really a bonanza for the legal industry. It's a bonanza, it's a stimulus for lawyers. It's really good for plaintiffs' lawyers who are gonna have new opportunities to bring lawsuits, to get contingent fee awards, or to get fee awards under all of the different causes of action we're creating with attorneys' fees provisions, but it's not good for the rest of the people of Minnesota. So if you're for the plaintiffs' lawyers, I suggest voting yes. If you're for the people of Minnesota, I suggest voting no.
Further discussion on repassage of Senate File 2744 is amended by conference. I recognize the member from Morrison, Representative Kresha.
Thank you, members. And just a couple of comments on this bill. I remember when it first came through, I was on the Commerce Committee, and I remember when the individuals that had prompted this through an accident, and like the Shawshank Redemption, I remember the quote of Andy Dufresne, they had a quiet way about them. And as they came to the conference, we started to hear about this bill, and that has gone away. I remember what I realized is in here, we've now turned this into the family protection, the consumer. And it reminds me of another famous movie as I was thinking through this, because we have all this time, of The Princess Bride, where they say, I don't think that word means what you think it means. And so I started to think about this. This really doesn't mean that. And members, what's really funny is as the victims left the conference committee, you know who was left? It was the trial lawyers who were sitting there like Uncle Rico and Napoleon Dynamite saying, you know, if they would have just put me in, we'd have won the state. And my goodness, that's what has happened. The trial lawyers have taken this over. In over 6 years and 8 years, they've worked on this bill and worked on this bill. Members, this isn't a family consumer protection bill. This is an economic development bill, because there's unemployment and underemployment among the trial lawyers, and this will give them the jobs that they want. And my goodness, with every breath they take, they got to be looking at this going, this is an opportunity for us to take this on and get more employment. And I think to myself, just like Taylor Swift, you're the anti-heroes. You don't need this bill. You have plenty of work to do. And so, I mean, act like dancing queens and have your fun and go ahead and jump. But this is a terrible bill, and members, vote red.
Further discussion on the repassage of Senate File 2744 is amended by conference. I recognize the member from Stearns, Representative O'Driscoll.
Thank you, Mr. Speaker. I was wondering if I could ask the bill author to yield to a question. I want to clarify a point here, if I could.
Representative O'Driscoll, it appears that the author of the bill is not in the chamber, but I believe that he is nearby, so we will go and see if we can track him down and get him in here to answer whether or not he'll yield to your question.
I'll hold on.
Representative O'Driscoll.
That's fine, I'll hold.
Representative O'Driscoll.
Thank you, Mr. Speaker. And would the bill author yield to a question?
He will yield to a question, Representative O'Driscoll.
Thank you, Mr. Speaker. And Representative Stephenson, when this bill left the House floor, there was a provision in here about the Minnesota Department of Commerce doing a study on the reinsurance program and delivering that to Commerce. When we got to the conference committee, a multi-page letter was referenced to that. Commerce said they didn't feel that they were qualified, able, have the authority, et cetera, to do this. Could you review for the body what the bill now says the Commerce Committee will receive and the legislature will receive as it relates to the reinsurance report?
I recognize the member from Anoka, Representative Stephenson.
Thank you, Mr. Speaker. Thank you, Representative Driscoll. I think you may have misspoken. You said the Department of Commerce was supposed to do a study. It was MCHA that was supposed to do the study as it came off the House floor, and MCHA that sent the letter saying that they really didn't think it was appropriate for them to do the study. They said that they don't have the statutory authority to do work like this, that they don't have the capacity to do like this. It's not their role. They objected to it on a few different grounds. I raised the issue with the Department of Commerce, and they told me that there were places where that data that the study was looking for was already available. In fact, there had been a study done by the RAND Foundation that got at the same data. I asked Commissioner Arnold to send me a letter to that effect. She did. I transmitted that letter by email earlier today to Representative Doubt, who was the author of the study amendment, so that he would have that. I'm also happy to share that with you, Representative Driscoll, if you would like it, the letter from Commissioner Arnold. But the study language is not in the bill as a result of that.
Representative O'Driscoll.
Well, thank you, Mr. Speaker, and you are correct, and Chair Stephenson, and that's why I wanted clarification, because that report is not in here, but there will be something forthcoming to the Commerce committees in the House and the Senate on this. And folks, this is extremely important. Again, as Representative Doubt laid out the case just moments ago, reinsurance has been a godsend, a savior for a number of small families trying to cover their health costs and their health needs here in the state of Minnesota. Prior to that, when we saw back in the 1990s when the Clinton administration took over, then First Lady and former Senator now Hillary Clinton spent an awful lot of time in the state of Minnesota in the first weeks of her husband's administration, learning about how we do insurance here in the state of Minnesota. And the MCHA program that was referred to by the bill author, Representative Stephenson, was a monumental act in 1976. MCHA stood for the Minnesota Comprehensive Health Insurance Act. And what it did is it said we are going to provide insurance alternatives for people who are not able to be underwritten and meet the normal standards of underwriting. And what happened was we found a way to be able to put a safety net, a backstop, if you will, for these individuals who are rejected for health care. And it has worked marvelously well until Obamacare here in the state of Minnesota. What happened when Obamacare came is it caused a ripple effect of tidal waves in the insurance industry. Insurance literally became unaffordable, and those who did have it, group plans, et cetera, it became very expensive to be able to continue to offer that benefit and to be able to have health insurance to meet your basic health needs, let alone catastrophic losses. And so what the state of Minnesota did at that point is they went and they applied for a waiver to the Trump administration. Now, some of you probably just, what? Trump administration? Perks up your ears. There's more. Hang with me. And they said, Minnesota, you're trying something kind of innovative with the reinsurance program. We're going to give you a 5-year waiver on it. And not only was it successful in Minnesota, we had bipartisan congressional support in the state of Minnesota to try to nationalize that concept in insurance. Now, little known fact, and I can understand why people don't want this fact to be known, but the Trump administration and the Biden administration actually agreed on something. Let me say that again. The Trump administration and the Biden administration actually agreed on something. That was to allow Minnesota to continue to work in this incubator by giving us another 5-year extension on reinsurance in the state of Minnesota. The Biden administration saw that Minnesota was doing the right thing. And so last year, we sought reauthorization for reinsurance. We agreed to a 3-year plan. And I was very involved in that because I was the deciding vote on the conference committee to be able to make sure that we had reinsurance here in the state of Minnesota. There were 2 DFL members who were adamantly opposed in the conference committee, and 2 DFL members who saw the light of day and said, you know what, we need to continue to do reinsurance. And 2-2, you don't win. I was the Republican that was on there. And I cast the tie-breaking vote to be able to continue reinsurance here in the state of Minnesota. I'm ever glad I did. Because Minnesotans didn't see an interruption in their insurance coverage for health insurance. Minnesotans did not see premium increases that were in tow if the reinsurance program went away. Not only that, we stabilized the market for another 3 years. Then came the 2022 elections. And the first opportunity we got as a legislature with the new control was we were going to defund reinsurance. We're going to go into the premium security account and we're going to take money out of there, we're going to reappropriate those funds elsewhere. That's going to put that program at risk at some point in the future for Minnesotans who are the most vulnerable people. But don't worry, we're going to put the public option out there. Let me explain to you something about the public option. Minnesota Care is what is being floated as the public option. When you've been around this legislature as long as I have, you tend to learn a couple things about how processes work. When there are mandates that go in for insurance coverage, you must cover this, and this. It goes into the products that are offered in the private marketplace. And oftentimes in that language, there's an exception that says something like this, except for Minnesota Care. This does not apply to Minnesota Care. So if you were to lay 2 policies on the table with the price tags on those for insurance premiums, everybody's going to go, oh, I would really like the Minnesota Care, until they actually have to start using it. To cover some of the catastrophic things or to cover some of the mandates that have found their way in over time. We heard a member earlier today talk about how her family is benefiting from some of the different mandates that are in there. She wouldn't necessarily get that for her family in Minnesota Care. I haven't dug in to find out if that particular provision or allergy is covered, but I can tell you this, don't bet against it. It's most likely not there. That doesn't help people in Minnesota. But not to be outdone, this bill also has a provision in here that says we're going to Obamacare Medicare premiums in the state of Minnesota. We're going to pull out the requirement for underwriting on Medicare. Persons 65 and older who buy a Medicare supplement will no longer need to go through underwriting. Folks, if that story sounds familiar, that's what happened with Obamacare, or the Affordable Care Act, which we found out was actually unaffordable. We're going to stick it to them. First couple of years, it's going to look good when you get your premiums. Oh, look, I found a cheaper policy. They didn't have any underwriting. Until the market begins to stabilize, when it has been destabilized and pricing comes back in. I have suggested in committee, and I have suggested on this floor, and I'm going to suggest again today, that we in the state of Minnesota will be needing to look for a reinsurance program for Medicare supplements for seniors in the marketplace. And 3 or 4 years from now, we're going to be sitting in Commerce Committee and the Health Committee, and we're going to be saying things like, can you believe what the insurance companies are doing? The premiums for Medicare, Minnesota's most vulnerable, the greatest generation, won't come up with all kinds of reasons why it's the insurance company's fault for a provision that's in this conference committee report today that we all have a decision to make. My fingerprints will not be on the bill raising insurance premiums for Medicare, because I am planning on voting no on this bill. We are putting Minnesotans just in this bill through the ringer. moving from reinsurance to boat insurance. I just find the title in this, the Minnesota Family Protection Act. I think it really should be labeled the Bon Voyage Boat Coverage Act here in the state of Minnesota. Because insurance in auto, as Representative Dowd said, and he is correct, we are a no-fault state, so to operate your passenger vehicle on the roads in the state of Minnesota, you are required to carry liability coverage and no-faulting coverage, which would protect you and those riding in your vehicle in the case of an accident or injury, well, as the industry calls it, alighting a vehicle. Riding in, operating, or alighting a vehicle. We do not have that provision in liability insurance for boat insurance. What we have done is we have wedged it open and said we're putting it in there. In a liability policy. Liability is me being responsible to someone else. That's a misappropriation of insurance coverage under the very function and principles that insurance has been set out for hundreds, if not thousands of years across the world. Never has anyone been liable to themselves or to an economic unit the way this is set up. And boat carriers, boat insurance companies, 3 or 4 or 5 years from now, when they start getting these, and you sit down with your agent and they go, yep, it's time to talk about renewing. Oh, by the way, effective this date, we filed with the state of Minnesota to no longer offer boat coverage. You're going to have to find that somewhere else. Well, why? Well, here's the history. And then what we're going to hear in Commerce, the audacity of those insurance companies. What are they doing? Stopping selling boat coverage here. People need to have that boat coverage. My fingerprints won't be on taking away boat coverage for people in the state of Minnesota today because I am voting no on this bill. Speaking of insurance, when this bill went off the floor the last time, I talked about the boats and bites. I had a couple people come up to me after and go, oh, boats and bites, I got it. Well, the bites part of this has to do with provisions in here that say insurance companies, when they have data in the market showing that some animals are more vicious and prone to attacking people than others, can either A, be charged more in premiums, or B, not covered. This provision now in the bill says you can't discriminate against a dog unless you know that that individual dog has a history of violent activity. And the part that was really fun after I was done, because I must have had some really good comments the last time. So I had people from both sides, my side and the Democrat side, coming up and going, really, I didn't know this. When I said a dog only bites once. And I go, whoa. Whoa. I said, yeah, because once your dog bites, the insurance company's going to cancel you. And you go automatically into the high risk pool. Good luck telling your lender when they say you got to have homeowners insurance. And you say, I can't afford it. And they're going to go, that is a breach of your mortgage in the state of Minnesota because you are required to carry homeowners insurance on here. And they will go and buy it for you. And they don't shop around like you would. And when you're in the high risk pool, oh, good luck. As my friend Scooby-Doo would say, ruh-roh. You got a problem on your hands. I found it kind of interesting. Since the conference committee met and was going to wrap up the conference committee a week ago Friday, then we met again on Monday, yet another small child was mauled here in the state of Minnesota by a vicious animal. This session, we were up to 3 or 4 instances where vicious dogs have mauled Minnesota residents. But yet, we shouldn't discriminate against the dogs. We know we have these issues. And some have further suggested, wouldn't you rather have them have insurance if that dog is going to bite? And I just say that is another misappropriation of insurance. It's almost like saying, I'm an arsonist. I'm going to burn my own house down because I'm going to be liable to myself. And I've got insurance, and isn't that a good thing because I can move my family somewhere else? That is about the logic that we're blending together with this philosophies in this bill. It's unbelievable what's going to happen to insurance premiums in the state of Minnesota. I'm sure that when I'm done speaking, you're going to hear another flowery explanation from the bill author who's going to say things like, this is a great bill for the people of the state of Minnesota. It takes into account consumers. It takes into account the needs of people. Our colleague, Representative New Brindley, did a great job of spelling out where the what I would call the want provisions are, stuff that people are kind of in the weeds a little bit on. But I've just outlined where 3 times insurance premiums are going to go up. Health insurance with the reinsurance program, bites and boats, and now Medicare. What you're going to see, boop, 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 there go premiums. There go premiums for Minnesota payers. Wow. Again, my prints won't be on this bill. There are a lot more things that I could talk about, but I think these are the things that Minnesotans deal with on a daily basis that will affect them, their families, on an immediate, upfront basis. As Representative Dowd said, and I will echo, I don't want to be the one that said, I told you so. But I've been around these regulated industries in Minnesota for an awful long time. And I've been around this legislature for a long time as well. And when you can start blending those 2 experiences together, it's pretty easy to start seeing what the future looks like. The last thing I want to end on is something that is just puzzling to me. And that is the right to repair. What could go wrong with that one? You don't have to be an authorized dealer. We're going to force the manufacturers to go ahead and turn over their technology of how to fix those units. As we give little names to different provisions and bills, this one should have been called the "No, but I'm willing to learn" on your devices about how to repair. Sorry about your voided warranty. Now I know what not to do next time when I get a phone in. And there's nothing in this bill that prohibits somebody from saying and putting a sign out that says, I will service. Notice the carefully chosen words. I will service your iPhone. I will service your devices. And they fill in the blank. If they're not, doesn't say they're an authorized dealer. We will be back soon with a consumer bill of rights. Why? Can you believe what's happening out there? Consumers didn't know when they went in that this person wasn't trained and wasn't authorized to be able to do this. This is an atrocity. Once again, created by this bill. But it won't have my fingerprints on it because I will be voting no. And I encourage every one of the members in this chamber, as we're going to hear the wrap-up speeches from the bill author and maybe a few other folks, to ask yourself, what am I going to do to my constituents if I vote yes for this bill? And what am I going to do for my constituents if I vote no with this bill? I'm pretty sure that the state of Minnesota would be able to get by for one more year without any of these provisions in this bill, and we go back to the drawing board and we actually take into account what Minnesotans are bumping up against. And I want to just take, on my final comment here, a chance to remind you one more time what I shared with you yesterday about what we're seeing, the direction of the state of Minnesota, our business climate, our workforce climate, which the Commerce Department, the Commerce Committee is charged generally with helping to preserve a fair and equitable marketplace for regulated industries. I've oversimplified that. But once again, according to a Chamber of Commerce report, Minnesota ranks 35th in the nation on GDP growth, ranks 40th in job growth, 35th in labor workforce growth, and 42nd in net domestic product. And the news in that report said Minnesota's workforce will probably be roughly the same size in 2030 as it is today in 2023. And as that final generation of baby boomers come of retirement age, we're going to have more people not working than we're going to have working in this country. This bill doesn't address any of those needs. Quite frankly, none of the bills have addressed any of those needs this year, ladies and gentlemen. We know we have areas where we need targeted help, education, law enforcement, teachers. Oh, don't get me started on teachers again. In a positive way. They do a lot, and we're asking a lot from them. And I thank them for their job and for their work, as I do the firefighters and the people in the healthcare industry for stepping up and doing what needs to be done. But this bill, nor the other bills, really help you. Thank you, Mr. Speaker and members. Again, my fingerprints won't be on this. Please join me with a hands-off approach and vote no on this bill. Thank you, members.
Final remarks on the repassage of Senate File Number 2744 is amended by conference. I recognize the author, the member from Anoka, Representative Stephenson.
Thank you, Mr. Speaker. Thank you, members. Thank you, Representative O'Driscoll, for your partnership on the committee this year. I enjoy working with you. I appreciate the good working relationship we have. I was struck a moment ago, you made some beeping noises on the floor just a minute ago, and I want you to know the good news about this bill is if your technology makes those kinds of beeping noises, you'll be able to fix it yourself. Please vote yes.
The clerk will take the roll on repassage of Senate File 2744 as amended by conference. The clerk will close the roll. There being 69 ayes and 59 nays, the bill is repassed as amended by conference and its title agreed to. Conference committee reports on House files.
Conference Committee report on House File Number 2310, an act relating to the environment and natural resources. The report is addressed to the Honorable Melissa Hortman, Speaker of the House, the Honorable Bobby Joe Champion, President of the Senate. We, the undersigned conferees for House File Number 2310, report that we've agreed upon the items in dispute and recommend as follows. The report is signed by 5 of the 5 members on the part of the House and 4 of the 5 members on the part of the Senate. Hansen R. moves that the report of the Conference Committee on House File Number 2310 be adopted and that the bill be repassed as amended by the Conference Committee.
I recognize the maker of the motion, the member from Dakota, Representative Hansen, to explain the report.
Good afternoon, Mr. Speaker and members and Minnesotans. This is the most significant environment and climate bill in Minnesota history, both in terms of its investments and its reforms. There are things in here that we have worked on for years. PFAS, EAB, CWD, AIS, MLCAT, and environmental justice. What is the difference in this report? And I will speak just on the environment side. Chair Akam will be speaking about the energy portion. But on the environment side, there were provisions that the Senate had that were with the administration in terms of money, investment in boating access, investments in soil health, and investments in climate resiliency. And as a compromise, we worked with the Senate to come forward on amounts that we think will serve Minnesota well. I want to acknowledge the work and thank our nonpartisan staff, Janelle Taylor and Bob Eliff from House Research, fiscal analyst Brad Hagemeyer, committee administrator Peter Strohmeyer, and committee legislative assistant Sam O'Neill, partisan researchers Spencer Krause and Amy Zipko. And also, a significant portion of this bill includes the recommendations from the Legislative and Citizen Commission on Minnesota Resources, Ms. Becca Nash and her staff from the LCCMR. It also includes the lands bill for 2023. So part of the thickness of the bill is it includes the lands bill and the LCCMR. But what does it do? It makes significant changes in terms of filling past commitments. We pay back the Metro Landfill Trust for landfills. We restore much of the money that goes to lottery and LUA to make sure that there are investments in the future. We provide significant reforms and new opportunities for air quality through cumulative impacts and environmental justice. This was a team effort. There are articles, makes it easier for you to read. Many authors of the PFAS provision, many authors of the CWD provisions, much work on the environmental justice. I ask for your support for the conference committee report.
I recognize the member from Hennepin, Representative Akam, to explain the report.
Thank you, Mr. Speaker and members. Really glad to be here today to talk about this conference committee report. As Representative Hansen said, or as Chair Hansen said, I'll be speaking more to the energy side of our conference committee report. And I will say we certainly came out of the conference committee with a really good, strong bill. And I think it's a bill that touches every corner of Minnesota. It reflects both the House and Senate priorities, and it recognizes the importance of addressing climate change. It establishes programs and opportunities to make Minnesota competitive for the Federal Inflation Reduction Act funds as well as the IIJA funds. And it prioritizes equity as we are working to implement climate solutions throughout the state. As I talked about when we passed the bill off the House floor, the budget bill off the House floor, this is a bill that really works at partnerships and working both at the local level, the state level, and the federal level to work together to really solve our problems. And I think that's how we get the best work done. And it's taking a proactive approach to address the climate crisis that we're in and try and prevent the worst impacts of climate from happening to Minnesota. There are so many great things that are included in the bill. We have a lot of equity provisions, as I talked about. We want to make sure that we are helping those people who have the least be able to do the most. And so focusing on low-income people, homes to deal with weatherization. And we developed the Minnesota Climate Innovation Finance Authority to really target those investments. We developed a tribal advocacy council looking for diversity reporting from our utilities. And the list goes on. There's so many great things within the bill. But I also want to, just before we move on, is make a few thank yous. And this would not be possible if it weren't for wonderful research staff, Bob Eliff, our fiscal staff, Ashley Eng, the amazing committee administrator, Mike Molzon, researchers, Eric Anderson and Mark Knisely, and I'm hoping I didn't forget anybody, but if I did, I appreciated your help. This is a team effort for sure. Thank you all for being a part of it. Happy to be here today to discuss the conference committee report. Thank you, Mr. Speaker.
Further discussion on the motion to adopt the conference committee report for House File 2310. I recognize the member from Crow Wing, Representative Heitzman.
Thank you, Speaker. And I rise to a point of order on further consideration.
Representative Heitzman, state your point of order.
Thank you. I rise for a point of order on further consideration of CCR HF 2310 under the Joint Rule 2.06, and I'm prepared to offer advice.
Representative Heitzman, please state your advice.
Thank you, Mr. Speaker. Members, under Joint Rule 2.06, a conference committee report may not delegate rulemaking to a department or agency of state government or exempt a state department or agency of state government from rulemaking unless the delegation or exemption was included in either the bill or the amendment that was referred to the conference committee. In Article 3, Section 29, there is a new expedited rulemaking for the capital assistance program provided in the bill. This rulemaking was not part of House File 2310 when we sent it to the Senate, nor was it included in the Senate amendments to House File 2310 when it was returned from the Senate. Nor was this expedited rulemaking provision included in any of the side-by-sides for the conference committee to consider. Therefore, this new rulemaking online, if you're looking for it, members, is on 167.27, is a new delegation of rulemaking to the Commissioner of the Pollution Control Agency that was not included in the bill and referred to conference committee.
Advice, Mr. Speaker.
Representative Dowd, state your advice.
Thank you, Mr. Speaker. Clear as a bell here. This is a clear violation of our joint rules 2.06. The representative read the rule in its completely, and there isn't an option here. We can't take up the bill. It's not really before us. The bill has to go back to conference committee, and we either have to strip out rulemaking or the bill has to be reconsidered. The original bill has to be reconsidered by one of the bodies. The Senate had this same thing happen this week with the labor bill. I think it was Senate File 3035, Earned Sick and Safe Time. It had some rulemaking in it that didn't appear in either of the bills that went to the conference committee. So there's literally not a choice. The Senate made the right decision and sent the bill back. So rather than debate this for a long time on whether we should or not, this is very clear. There is rulemaking in the bill that was not in either of the bills that went to conference committee, and therefore it is a clear violation of our joint rules and needs to go back to conference committee to have the rulemaking stripped out. So I would ask that you find the point of order well taken.
Further advice. I recognize the member from Lyon, Representative Swedzinski.
Thank you, Mr. Speaker. I also stand for some advice to the body. You know, this institution is not made of men, not made of women, but of rules. Those are crafted to keep the guardrails of legislative action on the straight and narrow. And not just for the TV cameras, but for the process. The process is important. These rules, 2.06, Representative Heitzman pointed out quite succinctly, we're outside the bounds of the rules that we all agree to. The public deserves better. We can do better. And one of the ways that we can do better is send this back to conference committee so that these things can be dealt with in accordance to the way that are along the lines of our rules. Representative Heitzman, I want to thank you for standing. You know, this is not a yes or no on the bill. This is not, is this a good bill or a bad bill? This is about the simplicity of the rules that we'd like to govern ourselves by. This legislature is going to be passing a lot of laws, folks. Some are good, most will be bad, but that's what this debate is not about. It's not about, does this bill make energy more affordable, more reliable, safer? Does it bring the cost of doing business down when it comes to following environmental laws? This motion, this advice that I'm giving the body today is simply, folks, most of this bill was not done in the light of day. It was done in the dark of night. And because of that, something happened that's against the rules that we govern ourselves by. We've got the time, members. You know, I'm just a simple man. I ask you to just give us the 3 steps of shining the light of what this legislative action, doing things that are best for Minnesotans, and living within the guardrails that we set for ourselves. Those 3 steps. Remember, it is Wednesday today. Tuesday is gone. There's not going to be another Tuesday in this legislative session. Tuesday's gone. It's Wednesday today. We'll be done Monday. We've got plenty of time. You know, maybe this legislature will try to finish this job up on Thursday or Friday. Or this legislative session may just be a Saturday night special. But members, we have an opportunity to just send this back. Let's do it right. Let's follow the lead of the Senate. Let's deal with the issues, folks. If we can't get the foundations of how this body operates by following this green book, if you didn't want it in here, you had the power to get rid of it. If you say, you know what, let's go back, let's just rip 2.06 out of the book, throw it in the can, but it's there. For the public's sake, for your sake, for the sake of this institution, for the sake of the folks that built the foundation of this very building and their ancestors. Support the Heinzman.
Further advice to the Heinzman point of order.
Mr. Speaker.
I recognize the member from
Mr.
Carver. Representative Long, the member from Hennepin, the majority leader, Representative Long.
Mr. Speaker, I move to lay the conference committee report to House File 2310 on the table.
Representative Long has moved that the conference committee report on House File 2310 be laid on the table. All those in favor, please say aye. Aye. Those opposed, please say no. No. The motion prevails. Conference committee reports on House files.
Conference committee report on House File Number 2, an act relating to employment, creating a family medical benefit insurance program. The report is addressed to the Honorable Melissa Hortman, Speaker of the House, the Honorable Bobby Joe Champion, President of the Senate. We, the undersigned conferees for House File Number 2, report that we've agreed upon the items in dispute and recommend as follows. The report is signed by 3 out of the 3 members on the part of the House and 3 out of the 3 members on the part of the Senate. Richardson moves that the report of the Conference Committee on House File Number 2 be adopted and that the bill be repassed as amended by the Conference Committee.
I recognize the maker of the motion, the member from Dakota, Representative Richardson, to explain the report.
Thank you, Mr. Speaker, and that is my my motion. It's a good day in Minnesota when we are able to work to ensure that families will be able to care for themselves and for their loved ones as well. The need to care for ourselves is universal, and it is something that touches all people's lives across age, region, community type, family structure, political party, life stage, and yet only 1 in 4 people have access to paid family and medical leave. Heading into conference committee, the House and Senate files had some significant alignment, and there were also several substantive differences. I want to spend a little bit of time talking about some of the changes that were made in conference committee. One of the most significant changes related to the timing of the implementation of this program. The bill that left this chamber initially had premiums and benefits starting on July 1, 2025. And as a committee, we worked jointly on a timing change, and the bill now has premiums and benefits starting 6 months later, January 1st, 2026. Another change is related to a cap on premium. The bill that left the chamber had no cap, and this has a 1.2% cap. The conference committee jointly developed a provision related to the actuarial study that is commissioned by deed, which allows the department to adjust the premium rate subject to the cap. And as it relates to weeks of leave, an employee would be able to take up to 12 weeks of leave for family leave or 12 weeks of leave for medical leave. The overall cap, if someone were to experience both a need for family and medical leave in the same calendar year, would be 20 weeks. New provision from the conference committee is language that comes over from the Senate that creates an account to pay the PFML premiums for direct care workers. There was a $20 million appropriation related to that. We worked together as a conference committee to develop and adopt a definition of seasonal employees, and that is inclusive of hospitality workers, where employer receipts for the quiet half of the year could be no more than 33% of the receipts during the busy half of the year to qualify under that carve out for seasonal businesses that are employing seasonal workers. It also creates a certification process for the department to administer. The committee also worked jointly to modify the small business assistance grants that are within this bill. For small businesses that find it necessary to hire temp workers or to increase the pay of current workers to cover a shift for another worker who takes paid leave, and the maximum total grant amount that would be they would be eligible for in a calendar year is $6,000. The report also adds clarifying language around state income taxes, making it clear that the benefit is in fact taxable and that workers have the opportunity to elect to have those taxes deducted from benefit payments. We also worked within the conference committee to develop language and add provisions related to misrepresentation. The new language establishes that if an applicant obtains benefits by making intentional false statements or other fraudulent means, that they would be guilty of theft, and that the current fraud statutes that we have in place would apply. We also clarified that the definition of active duty includes both foreign and domestic deployments. I want to take a little bit of time to spend just lifting up some of the ways that this bill supports small businesses, because we've heard quite a bit about the need to ensure that we are supporting small businesses. I talked briefly about the small business assistance grants that would be available annually that would provide that total grant award of up to $6,000 to hire temp workers. And we narrowed the access to that to the smallest of businesses. So for employers with under 30 employees and also with revenues that would be under $3 million. There's also premium reduction for small business owners. And this is not a new provision in this bill. This is the provision that was in the bill when it left this chamber. For the smallest business owners, those with less than 10 employees, many of those will pay $0 in premiums. For example, under this bill, an employer with 9 employees who each make $50,000 or less a year would not
Members,
have to...
please take your conversations off of the House floor. Representative Richardson.
They would not have to pay any premiums for that year, but employees would still be required to contribute. And businesses with less than 30 employees would also see premium reductions as well. It's a graduated scale, and it creates a space to ensure that we are not only supporting workers, but we're also supporting our small businesses as well. This conference committee report reflects a collection of voices, perspectives, and experiences, including groups representing employers, large and small business owners across the state, the insurance and construction industries, realtors, city and county considerations, nonprofit and social organizations, the faith community, and importantly, families. There is strong bipartisan support for paid family and medical leave because families know that a serious illness or an injury can be devastating for families, not only physically, but financially. And a uniting factor is that all of us at some point are going to need to care for ourselves or for a loved one. And the reason that there's such strong support for paid leave is because Minnesotans care about each other, and we know that families are worthy of care. And with that, Mr. Speaker, looking forward to today's discussion.
There is a motion at the desk. The clerk will read the motion.
Damath moves that the House refuse to adopt the report of the Conference Committee on House File Number 2 and that the bill be returned to the Conference Committee.
I recognize the maker of the motion, the member from Stearns, the minority leader, Representative Damath, to explain your motion.
Thank you, Mr. Speaker. And I am making the motion that this bill would be returned back to the Conference Committee. As you know, members, the majority, the House Republicans, Senate Republicans, were not given a spot on this Conference Committee. And so effectively, as you have heard on other bills, the voices of 48% of Minnesotans were completely shut out of the process. As you did your work and brought together what you thought would be the best thing, you only listened to just over half of Minnesotans on that. You only represented half. Well, we have things that we have brought up as this bill was first brought onto the House floor as we debated it and passed it off this House floor, completely bipartisan. We have things that we feel still need to be discussed on this bill. And I want to be clear that Republicans do supporting families and Minnesotans when they need to take the time off for a medical reason, the birth of a child, caring for a loved one. We do support that. You also heard that we offered a very reasonable option that would accomplish the same thing, that would have not expanded government bureaucracy. It would have not created a brand new division within DEED. It would have not created new payroll taxes for both employers and employees. And as Minnesotans are watching, I want to make sure that when you hear the Democrat majority talk about premiums, it sounds nice, but it's actually a payroll tax. It is not just a premium, it is a tax. What we would have proposed also would not have required a new IT system to be built from the ground up. And you know that Minnesota does not have the best track record when we build IT systems from the ground up. I believe you are going to be hearing from my colleagues on this motion to return this conference committee report to the conference committee to actually do the work that needs to be done. You will be hearing the details of that and why it is important. We have listened to Minnesotans on this. We know this is something that is important, but as proposed in this bill, it is not sustainable. It is not going to work. It is not affordable, and it is very, very concerning. And with that, Mr. Speaker, I would like to request a roll call on this motion.
Representative Dameth requests a roll call vote. Seeing 15 hands, there will be a roll call vote. Is there any further discussion to Representative Dameth's amendment? Representative Joy, if you're seeking recognition, you can rise to seek recognition. The member from Clay, Representative Joy.
Thank you, Mr. Speaker. I'm surprised this bill came back to us. I think it needs to go back to conference committee. Again, we're shut out. Our voices are silenced. I was surprised to see that my senator on the other side of the aisle sat in this conference committee. We had a meeting with 64 businesses in our district, one of them being American Crystal Sugar, so it was small to big. That said, they do not want to see this move forward. This is going to hurt us in the business world. Main Street businesses, this is going to hurt. We keep saying it's a premium, but it's a tax, and you can pass it on. We said, well, you can pass it on to the employee. Again, last night we talked on the floor. As we continue to do this to businesses and pass this on, what we are doing is we are continually taking money out of people's pockets. So if we are going to give the person a raise in the highest time of inflation, we're now going to pass on a fee to them, a tax. And we think this is a good idea. Even though we can avoid the premium for the employer, but we're going to push this back onto the employee. You know, think about it when you own a cleaning business, if it's 2 employees. You're forcing this back on. You know, when we think about this program right here that we're deciding on, that we had 0 representation on, is going to create 400 new employees for Minnesota. Again, Minnesota's growing employees. Apparently there's no shortage of workers. We'll just grow 400 new employees. When you look at that at $20 an hour at an average for an employee, we're growing our payroll here in the state of Minnesota over $16 million a year. That's at $20 an hour if we pay these 400 new employees. $16 million a year to run this program. Just that. That's not paying benefits or anything. I don't understand. I know this is a program to make sure that people get time off, but it's not a one-size-fits-all. Opt in, opt out. They say there's provisions in here for smaller employers and they don't have to. This doesn't work. $16 million a year. You know, when we look at this and we're like, payroll's going to increase 400 new employees, it's $16 million a year just for the payroll side of this, and nursing homes are closing. I guess this is good for us. This is what we want. This is what everybody wants. No, this isn't what small business want. You continue to force mandates, regulations on every business, and we want to make sure people are having a better life, better living, but we're forcing it out of their increase in their payroll because we have to pay for these somehow, everything that's coming through. And I can guarantee through this program, it's not going to stick to these numbers. It's going to fall way outside these numbers. The numbers in here are just a feel-good number, I think. Why don't we send this back to conference committee, get bipartisan work again on here, and get everybody at the table, and not ignore. You know, maybe in this district down here, this is what they want. In my district, I had 64 employers say no. I don't know if this is our way to attract employees from North Dakota because we offer paid family over here and they don't. This is how we create more people to come over and fill our job gaps. I don't know. I mean, but this isn't the program everybody wanted. I just am surprised Minnesota and the Democrats continue pushing these hard programs of a $16 million payroll year. Now, I'm kind of curious, is Minnesota state employees exempt from this? Probably not. So we're going to have a payroll tax on that $16 million of new money, I'm sure, we're creating. So that's going to have to come from somewhere too. Why don't we send this back so we move the numbers around, got less weeks? What are we doing? What are we doing here? I know we will get debated that people need time off. They need to be gone from their employers. We don't have the numbers in here what's going to cost the employer. We can apply. So my wife can leave my place of employment, a business we own, and I can apply for the $6,000 grant because of my small business. To me, I think that can be some fraud too. I don't think that's a good idea on this bill because it's going to be used wrong. Again, here we sit in the chambers debating a bill with no representation from this side of the aisle, ignored us, knew that we just have to take it. We have the trifecta, we'll force it over there. They'll be fine with it. When do we figure this out, that this isn't what everybody wants in Minnesota? This is not what all the employers want, small businesses. We heard this, all of us got emails on this. Don't do it, stay away from it. How about we sit down and figure out something else? Opt in, opt out. If the employees that work for me or work for anybody in small business, they stay with us because we take care of them. Now we're going to have the government telling us how we're going to take care of them. Don't do your help, Jim, that when they were off for COVID, you still paid them even though they were part-time employees. Their car was broke down, you helped them. You fixed their car for them. Takes all those options we did before and forces it to this program that we have to follow by the state. Let us run our businesses. Let's not have Minnesota come in and tell us how we are going to run our business. That's what we're doing here. We're doing this with everything we do. Retirement, with this. Here's what, if you want a business in Minnesota, here's what you're going to do. This is ridiculous. Members, send this back. Let's get some bipartisan work on this. Try to work through this, see what we need. We don't have to rush it through this year. Let's put it back in next year. Let's talk about it. Let's listen to every business owner, every business voice in Minnesota. Thank you.
Further discussion on the motion to refuse to adopt the Conference Committee report for House File 2. I recognize the member from Hennepin, Representative Robbins.
Thank you, Mr. Speaker and members. I rise in support of the Dameth motion to return this back to Conference Committee because it's a new day, it's Groundhog Day. Another report has come before the body where there was no minority member on the Conference Committee. I just don't know why you keep doing it, honestly. We know you have the votes to pass a lot of these bills, but the point is that the voice of the minority should not be silenced. And when you refuse to seat a minority member on a conference committee, to even allow our perspective to be heard in public, that is a disservice to this body and to this institution. And that is why it needs to go back. Members, we know you have the votes. We know you have control of all three branches of the legislature and the governor's office. But that's not the point. The point is that we need to be able to have our voices heard and represent our constituents. And we are unable to do that when we are not even in the room. And when we don't even know when meetings are happening, when discussions are happening, when the public cannot even be informed of when they could come and follow the conference committee or watch testimony. It is wrong, members. That is beneath this institution, and it is beneath your leadership of this institution. So I encourage you to, in the future, appoint minority members to the conference committee. And because that didn't happen in this instance, I urge the body to send this back to conference so that it can be considered with minority viewpoints in public view. Thank you, members.
Further discussion on the motion to refuse to adopt the Conference Committee report for House File 2. I recognize the member from Dakota, Representative Whitty.
Thank you, Mr. Chair. Members, I stand to resend this back to Conference Committee. When I first retired, my first job was at our local Simon Ace Hardware in Lakeville. I did it for a purpose. I missed the part in law enforcement where you get to connect with people, and this was the opportunity to do that. And everyone knows Ace is the place with the helpful hardware person. So I figured I'd go in there and learn a lot. Unfortunately, I didn't have all those skills, and I had an alternative motive. I got 3 daughters. I wanted to learn some skills on plumbing, electrical, and this was an opportunity to learn so I could get into their houses when they finally have their own homes, help them, and maybe get a free dinner out of it. But I will tell you, it was much more. I shopped there. They recruited me off the floor, not really for my skills, but honestly, the young manager said it was because of the color of my hair. And they wanted older people on the floor working. And I told them I just want to learn. And they gave me every opportunity to learn. And there was that purpose to come back. We would do freight on Wednesdays, and we'd be putting the freight around. And my motivation was I'd buy pizzas if we're halfway done, so we get the freight out there. And then it picked up, and other people did that. Or I'd go in and we'd share stories, and just made that experience a lot more fun. But it also, like I said, it gives you that purpose and reason to help others. I got to meet a lot of people from the community, which was very important. A lot of widowers that were looking for help. And a lot of times they just walked around the store just to talk. The reason this would hurt is a lot of people, when we're looking for workers, they might not want to pay into the payroll tax. And I was fortunate because, as the Minnesota Chamber says, 80% of the businesses already offer this. I work for the Minnesota Twins in the summertime. So we made an agreement with this small business that probably had less than 25 workers. And their agreement was, come May, at the end of May, I could leave until whenever the Twins were knocked out of the playoffs. And as we all know, that was always September, unfortunately. But that was an opportunity when the kids came back from school. And when they went back to school, I could be there to help out. And with that agreement, they didn't have to do it. They weren't told. It was a benefit that helped me, and it helped them. I think Minnesota expects us to work together. I think we're stronger when we work together and we listen, learn, and understand each other's points of views on the issues. And that's what I'm asking for today. Thank you.
Further discussion on the motion to refuse to adopt the report of the Conference Committee on House File 2. I recognize the member from Carver, Representative Nash.
Thanks, Mr. Speaker. So I guess the question is, why do we refuse to adopt sometimes or frequently? Well, one has become process-oriented. And as I said yesterday in the conference committee that I have been serving on, process has been good. It's been very respectful. I have been notified of things. I'm kept informed. Differences in policy are oftentimes hammered out and spoken about in the open. And then there's other conference committees that we see. I guess another reason would be because of bad ideas in the bill from a workability perspective. And don't hear me say that I'm demeaning ideological differences. What I'm talking about are the nuts and bolts or the workability of certain, and I've raised this objection to the many authors over the years about one of the principal concerns that I have, which is the IT part of this software, this magical software that's supposed to exist out there, that it doesn't. It doesn't work. The Washington model is deficient. The proposal for new technology should scare all of you who are associated with voting for this bill or on a committee or whatever, or if you work in technology, you know that simply assuming that an enterprise piece of software that will get stood up in a prescribed point of time is always going to work, that should frighten you tremendously. And because this piece of software doesn't exist, and because there are assumptions that it's going to go forward without hiccup or problems, that is optimistic and perhaps optimistically naive that this would actually come to a point where it could work. Now let's go to the next phase. You're seeing and have heard many, many points of pushback. And, you know, yesterday, I think it was yesterday, we talked about education. What I know from speaking to many of the school boards in my district, there are several that I serve, they are terrified about what this does to them. That they don't have the ability to absorb what the costs will be because they can't, like a city, levy at the end of every year. So they have no methodology to come up with the money that's going to be taken out as a payroll tax. They have been objecting to this since this bill first came to light. I think I saw it 6 years ago. I think it's been in the works for quite a while. And I think Representative Bakeberg could probably tell you, and I think I just saw him get recognized, so I'm sure he'll tell you about some of the problems that arise from that. But I will also point out that I have taken a fairly concerted effort to meet with many small businesses in my district on main streets. And I've gone up and down various places in different cities that I represent, asking them, if this were to happen, what does that do to you? Not one of them has said, oh, I think this is a great idea, Jim. I think that this is exactly the way that I envisioned this if I ever envisioned something along those lines. You know, our Republican caucus offered some alternatives that I did run under the noses of some of the people that I talked to, and they liked a more market-based approach where they could enroll their employees, but that it was not as heavy-handed as this. The costs of this bill are groaningly heavy. They will be a heavy encumbrance on small businesses on Main Street throughout the state. It won't just be Waconia or Carver or Watertown, Mayer, Hamburg, New Germany, Chanhassen, Chaska, Victoria, places in places in Carver County where I know a lot of business owners. It won't just be there, but it'll be in places up north, in the resort areas. It'll be in Rochester. It will be in many places around our state where small business owners are trying to stay afloat. What will happen, as I've asked, and not only is it the school boards that are opposed to this, the chambers are opposed to this, NFIB is opposed to this, and they are truly the voice of small businesses. But what they're saying is, Jim, places like floral shops or jewelry stores, movie theaters, bookstores, coffee shops, small businesses are going to be put in the crosshairs. That's why we should send this back. We should say not only is a lot of the technology that this is predicated on not workable, doesn't exist today. That software does not exist. But moreover, why do we send it back? We should send it back because businesses are going to get hurt. You know, the bill that we debated yesterday, I think, if someone could maybe correct me, I think there's 65 mandates in the education bill. 65 mandates, unpaid, unfunded mandates. This is also going to be incredibly disruptive for the school boards because they don't know how they're going to come up with the money for this. And I see some of you shaking your head at me in disagreement. Well, I've spoken to the superintendents. They're the ones that are saying this. This is not Jim Nash saying this. This is the superintendents that are saying this to me. This is the school board associations saying this. They are vehemently opposed to this. There's no funding that's going to be able to make this up. I talked to one of the superintendents and they said, Jim, if you combine paid family medical and the education bill with the 65 mandates in there, you would have to give us 10% and 10% on the formula just so we could break even. That's alarming. In my time here, I think this is the largest that we've seen, but it's traditionally been 2 and 2 on the formula. Well, you're down 8 and 8. And because the bill that came out of here yesterday hasn't become law, We don't know, but 2 and 2 is what's traditionally been on the formula. They're still down 8 and 8, and they're terrified because they don't know where that's going to come from. But Main Street businesses, there's a lot of restaurants in my town. There's one that just opened up. I invite you to come out. It's called Bodie Gray's. It's fantastic. It repurposed a building that when they said, oh, we're going to put a restaurant here, I didn't quite see how it would work, but it is now really a very attractive place. But they're going to have to do this because you're going to force this down their throat unless we send this back. And those owners, they don't have $100 bills falling out of their pockets. They're scrapping. If you've ever been in a startup of a business, you know, as I've said in the years past, you would mortgage everything, sometimes even consider mortgaging the dog, just to make sure that you have enough operating capital to keep going. That's why we should send this back, Mr. Speaker. That's why we should send this back and say to the conferees, you can do better. Technology does not exist and is suspect at best. At best. And I've asked the author in a number of committee stops, and this is not just this year's author, I've asked other authors in years past, help me understand the technology. Can't. It's always, well, we're going to take a little bit of this model and a little bit of that model, and we're going to hopefully make it work. If you've been here long enough and have lived through some of the technology disasters that we've seen here in the state of Minnesota, just that statement alone should terrify you. So that's why we should send this back. You know, I had a friend that reached out via text and said, Jim, we've been watching you. I guess they were really bored and they just wanted to see what we do down here when we have long floor debates. But they said, Jim, why are you making a motion to refuse to adopt? And I said, well, here's why. Here's why, because it's unworkable. Or in the case of the environment bill, rulemaking was thrown in very hastily and in a dark room. But why do we send things back? Because they can't work. We're trying to force the conversation because we were not invited to the table. That's why we send things back. We should not do this to the businesses and school boards. We should not do this to the mom and pops that are trying to open up a business in Main Street, Minnesota. You know, I have friends that own lots of businesses, and as I have said in the past, I am a recovering business owner, having sold my business. This is very heavy-handed. I think the term from Latin and in literature is due machina, the hand of God just sort of comes down and squashes you like a bug. Much like a Monty Python movie where you see the giant foot come down and squash you. That's this. That's why we send this back. That's why we should send this back. Don't allow the state to make the Latin term due machina become reality. Don't do that, because what's going to happen is the people who do own these businesses are either going to close them, and as Representative Joy, who his chair is here at least, Representative Joy was pointing out how many of them will just go across the border to another state. Or, as is the case in some of my cities, people are just closing businesses that are portable, and they will take them to another state. That's why we send these back. You know, I don't want to read in the paper that gets delivered to my home that there are more and more and more bankruptcy filings, because that's where they publish them. If you ever watch, if you read the whole paper, you'll see that certain businesses are filing for bankruptcy. So, you know, you might see a machine shop file for bankruptcy. You might see a florist or a coffee shop. You might see a coffee shop file for bankruptcy. And we don't want to see that. You know, we don't want to see, you know, other things that are great attractions for us, like a movie theater. We don't want to see that happen. We don't want to read about that in the paper. That's why we send things back. That's why we say we're going to go back and maybe pull something out, or have the courage to say, you know what, we're going to bring it back into committee. We're going to hold it there We're going to keep working on it, and we're not going to let this become reality because it will adversely impact Minnesotans. It's going to put up a sign. You know, when you drive into various cities, you'll see, "Welcome to so-and-so. We're a friendly city," or "Welcome to so-where, you know, we're a tree city," or whatever. I think this sends a message to folks who might be driving into Minnesota. Welcome to Minnesota, we're anti-business. Members, support the Dameth motion. Send this back. Don't adopt this. As I said, I have yet to hear from anybody that this is something that they are desiring. What they're desiring is that you don't do this. What they're desiring is that they would not be forced into bankruptcy and personal foreclosure because they can't afford to keep up with the policies and the tax increases and all the different taxes that you're foisting upon them just this session. So, members, I would urge a green vote to support the Dameth motion. Thank you, Mr. Speaker.
Continuing discussion on House File 2, Conference Committee Report, House File 2, refusal to adopt. I recognize the member from Hennepin, Representative Elkins.
Thank you, Mr. Speaker. MNLARS, MNLARS, MNLARS. We can drop that. Guys, just in case you weren't aware of it, we replaced MNLARS in 2020. It's 3 years ago. We replaced it successfully in 1 year with off-the-shelf software. And the reason you haven't heard about it is that it works. It was a very successful project, and it's an indication of the way we now do things in Minnesota under the Walz administration, under the leadership of Minute Commissioner Tarek Tomes. When we first proposed paid family medical leave 5 years ago, we were one of the pioneers, and there was no commercial off-the-shelf software available for purchase to support this application. The initial plan was to take the custom unemployment insurance system that Deed had developed with Deloitte as a starting platform and enhance it for use with paid family and medical leave. That platform performed admirably during the pandemic. We were one of the leading states in administering unemployment insurance during the pandemic. But we're no longer a pioneer. At least a dozen other states have preceded us, and we can leverage their work. Washington and Colorado have built and implemented paid family and medical leave systems, also working with Deloitte. And Oregon and Massachusetts have implemented paid family medical leave systems based upon the Fast Enterprise unemployment insurance application. Minnesota is a Fast Enterprises customer. We currently use a Package Fast application for driver and vehicle services, which is what we use to replace to build the MnDrive system that replaced MnDRARS. And the Department of Revenue uses Fast GenTax system. All of the major vendors of payroll systems used by businesses have already integrated with these package paid family and medical leave applications. The current fiscal note for House File 2 is therefore kind of a worst-case scenario as it reflects the cost of building a new system upon our current UI system, not buying a proven commercial off-the-shelf solution. Deed has recently received several very attractive responses to a request for information from these above-named vendors and others that would lead us to believe that the actual IT cost could actually be significantly less than the amount estimated in the fiscal note. Members, we have 2.5 years to implement a commercial off-the-shelf software system. We have several to choose one, and it would basically be, similar to the replacement of MnLARS with MnDrive, which, again, we did in 1 year. We've got plenty of time to do this, and the risk at this point, building upon the work that's already been done in other states to create a commercial off-the-shelf system, is there to be leveraged. The risk on this is extremely low. Thank you, Mr. Speaker.
I recognize the member from Travers, Representative Backer.
Thank you, Madam. Mr. Speaker, thank you. Sorry for that. And members, I stand to support sending this back because one of the challenges that we have is, and I'm not going to question the confirmands that are on there, but I am questioning that first of all, we did not have anybody on this side. I know that's a broken record. We've heard that before. but we also need some people with additional experience. Let's just use that so we don't talk about motives, but additional experience of running a small business from a different perspective. You know, on this side of the aisle, we are generally made up of greater Minnesota individuals, suburbans. Yes, there are greater Minnesota reps on the other side, and that's great. But the vast knowledge over here that we have with members on our side of the aisle can make this bill better. When you take out that type of experience of individuals like myself who are already providing this benefit, I think I could bring additional experience to this. If not me, maybe Representative Joy, Representative Baker, Representative Nash, and so many others. Representative Knutson, who runs a small business in her backyard, and her family. One of the things why we also have to send this back is what I'm hearing. Again, this is a border perspective, which there's no one on the conference that has a district next to another state. I'm fortunate to have two states, North Dakota, South Dakota, but I really have people in my community saying, you mean I'm part-time, I work at the local hardware store, like Representative Weens talked about. I'm only there for a couple hours a week, and I have to take possibly 1 up to 7%, because if you do the math, this baby could explode. And we're going to have to take more of their payroll, not just the employer, but the employee's payroll. You know, right now, this week, we are doing a hiring process of part-time for the summer because we're busier in May, June, July than in February when there's a snowstorm. And these part-time people are like, really? So what we're going to start to do is not just export job creators, we're going to export staff members, employees, because big government knows best, because that's what this bill does, knows best, instead of someone who's handling their own financing and so forth, who's 18, who's 17, who's making money just to go to college. They're not looking for paid family time or anything like that. They're looking to make money for college because their family doesn't get free college because they don't qualify with that $80,000. That's a whole nother issue. Why we have to send this back is because we need that perspective of business owners who are already providing that. And we didn't hear that. Right now, with the gold card side of my business, we have a staff member that just had a little one. We're already going on, I think, week 6. Time flies when you're having fun. It's not down here, but time still flies when you're having fun. And we're working. Now, I didn't, but my twin, the better half, the identical half, the better-looking half, talked to her this week, and she goes, you know what? I'm quite frankly getting tired of just being at home. I think I could work 2 or 3 days. I got grandma, which is her mom, who can watch over the little one. Can we make an arrangement that I could come in 10 hours I just miss everybody at work. I miss that work. You know what? A bureaucrat in St. Paul won't call her. The bureaucrat in St. Paul will not know the infant's first name or anything like that. That's another reason we have to send this back, because that practical experience, like my father would call street smarts, can serve the state well, can make this bill better, and so forth. And again, the challenge is, from a small business perspective, if somebody takes that full 20 weeks, folks, that's nearly 40% of the working hours that a person is gone. And then we got to scramble. And quite frankly, you're not going to scramble. What you do, just like what we've done, myself and Amber, another person, Nikki, we have been helping filling her spot, because you can't hire someone for 8 to 10 weeks and train them a whole new of some that she's known for 3 to 4, 5 years just to fill in 8, 9, 10, 20 weeks. It doesn't work. So people pick up the pieces, which mean they're working longer hours, which puts more stress on their family. And already 80% of the people are providing this. So this is why it's so important to get a different perspective, not to make this worse. We on this side of the aisle understand the importance of family paid leave. We're doing it. 80% of the businesses are already doing it. And in greater Minnesota, we do things differently. We heard a great speech yesterday on that. We just do things differently. We fill in differently. And that works. What works in St. Paul doesn't work there. And for surely, a bureaucrat sitting in St. Paul doesn't understand that. Let's make this bill better. Let's send this back to conference. And we would love to have one of our members help you out to do a better job, because we want to make this better. So thank you, Mr. Speaker. Thank you, members.
Continuing discussion on Conference Committee Report, House File 2, refusal to adopt. I recognize the member from Goodhue, Representative Altendorf.
Thank you, Mr. Speaker. And I rise today in support of refusing to adopt the paid family leave and to send this back to the committee. We really need, I think at the very minimum, Minnesotans want us to be doing things the correct way. And this has been really reckless, and it's actually very surprising. You know, as I'll say again, but the Democrats, they have the governor, they have the Senate, they have the House. And so there's no reason to skip the corners. At the end of the day, they also have the votes. Their legislation is going to pass through. And so this is such a big bill. This is something that is literally going to affect every corner of Minnesota. And I've been talking to people in my district. The Red Wing Chamber, they are very concerned with this. They are begging us to look at this. There's other chambers of commerce in my district that are begging for us to do this. With a $17.5 billion surplus, it is shocking and surprising, and frankly, it's dangerous what's happening right now with the mass expansion of our government. Because there is something about doing things too fast and too recklessly. Even though you have the power, it doesn't mean that you should do everything. We should be responsible. I'm very concerned for our schools, as we are already putting on them so many new unfunded mandates, and this is one more that's just coming. Yet I still, as many times as I have asked, do not know how this bill, how schools are going to be able to pay for paid family leave. I am asking for this to be sent back. Let's look at it this way. This is like a salad bar. The session is a salad bar. Everybody walks through, you grab a salad. But you don't put everything on the salad, because in the end, it's probably pretty disgusting, and it's messy, and it's gonna fall apart, and you really can't eat it all. Right now, because you had $17.5 billion surplus, because you had ultimate control, you took everything from the salad bar and you made this big, giant salad. Or you're trying to. And Minnesota doesn't want to eat it. It's not very appetizing. It's too quick, it's reckless, it's messy. Members, let's send paid family leave back to the committee. There is absolutely no reason to be doing so much damage to Minnesota in one session. I know sometimes we don't like to look at facts, it seems like in here. I'm not sure why. It seems like they're very important. But I think that there's a few facts that we need to bring up again. And one is that last year we lost over 19,000 citizens who were taxpayers. Also, between the years of 2020 and 2021, Minnesota lost $1.5 billion of adjusted gross income. I know Representative Garofalo tried to discuss this. I think he even put up a little table in the back and tried to discuss with members in the back that we had lost $1.5 billion of adjusted gross income. I think Representative Pinto went back and got that lesson, so hopefully that went well for him. But that is the facts, Minnesota. That is the facts. We lost $1.5 billion. It does seem like we want to California, Minnesota, and yet a couple of years ago, California sat at the same time where they had a large surplus. They implemented many of these laws that we are trying to do this session, and this is public knowledge. After implementing these laws, they are now in a huge deficit situation. Why are we looking to an example like California when what they did failed? Let me ask that again. Why are we passing laws and legislation that was tried, went through law, went through the process, was implemented, failed, and now the state of California is at an extreme deficit? As I grew up, I truly believed in what I'm going to call the American dream. The dream that if you worked hard, if you went to school, and if you worked hard, you could do anything. And that's when you hear the stories of very successful business owners in Minnesota and in America, I would believe that they believe that same dream as I did. That you would get educated, that you would work hard, that you would make a way for yourself. And the reason why paid family leave is very anti-American is that this is government dictating to businesses how to manage their businesses. 80% of businesses already offer benefits such as paid family leave. And yet, in the wisdom of this chamber, we think we know better than small businesses. We think we know better than the people that were willing to take out the loans, take out the financial risk, do the work, put in the time, and grow a business. 80% of businesses already offer benefits that are similar to this. And yet, in the arrogance, in the pridefulness of the bureaucrats who were elected to St. Paul, we believe that we know better. We offered amendments to even make this so that it wasn't quite so difficult, quite so bad for small businesses. We offered amendments to exempt small businesses that, were of 5 employees. But the Democrats said no. Can you imagine what kind of burden you are going to put on something like a daycare? A daycare that maybe only has 2 or 3 employees. And now they have to provide this leave. They have to. Because in our wisdom, in our ultimate wisdom, we made this law. Now, we are in a workforce shortage, and that daycare, they don't have any other choices. They're paying an employee to leave on paid family leave. They don't have enough people to work in the daycare to provide for the children. If the children are not able to come to the daycare is also not going to get paid. And it's pretty easy to see how quickly that small businesses are going to close. I am from an area of many small towns. We have many businesses that don't have very many employees in them. We already have a workforce shortage that will literally shut down production because of the ultimate wisdom of this body, of the bureaucrats, of the Democrats who think that they know better. We need to send this bill back to the committee and hear the voices of the actual business owners, the people who are begging for this legislation to be stopped. I asked a researcher, more specifically, if they could give me some examples of other states that offer anything like this paid family leave. And it comes to find out that other states do offer versions of the paid family leave. However, what Minnesota did, the Minnesota Democrats, in their ultimate wisdom, in their ultimate arrogance and pridefulness this season, they literally took every version of a paid family leave that's offered in another state and made it as extreme as they possibly could. There is no other state that has a program this extreme in the United States. We have no idea how our businesses are going to be able to provide. And because I'm on the Education Committee, I have been all session talking very closely to school boards, to superintendents and administration. They're already struggling with having enough teachers. No one is answering how schools are going to magically bring teachers into the fold to cover for the teachers that are gone. And no one has answered who is funding this. That seems like two very important questions that a legislative body that is about to pass one of the biggest new business burdens that we've ever seen in the state of Minnesota might want to understand how our schools are going to be able to cover the workforce shortage and how they're going to pay for an unfunded mandate. We are incentivizing not working. And this continues to be a very common thread throughout this whole legislative session. Can anyone tell me a story of a hero, of someone that worked hard, someone built a business, that someone did something great, whether they were an athlete, a business person, Someone share me a story that in that story they took off 20 weeks per year. We are incentivizing not working in Minnesota. We are incentivizing not being a productive part of our society. And that is damaging to us. We are not taking into account how small businesses are going to be able to keep their doors open. In rural Minnesota, I'm in a very strong agricultural district. We have times in our district, there's a co-op called Egg Partners. There's times when they are farming and they're delivering things to the farmers, whether it's fertilizer out to the field, seed, whatever it is. There's people that might be working 12 hours, 16 hours. And they have to do it because they have to get their crops in a very small window. And then they're paid for later, or they get time off later. But in that amount of time, there's only so much time to get their crops in. They have to work that much. Why is the government meddling in the private sector of private businesses making decisions of when their employees are going to be able to get off? I don't think we understand the unintended consequences that could happen to some of these businesses when all of a sudden they have to provide 20 weeks paid leave and they just don't have the workforce to do the job that needs to be done. We truly are having a clashing of ideas in Minnesota, and we're going to have to decide where we're at. Either we believe in people and we incentivize working hard to achieve, whether that's in school or whether that's in business. Or we continue down this path that we think we know better than small businesses, that we know better than the school boards, that we know better than local governments, the counties, the cities. And here in St. Paul, the bureaucrats manage and dictate to every other entity in Minnesota and tell them how to run their business. Paid family leave truly has the ability to be one of the most damaging laws passed this year to our small businesses. And just like many other of the pieces of legislation that have come across, this is falling on deaf ears, Minnesota. This is disgusting to watch. It truly is disheartening to see one party be so emboldened to think that they can just ramrod through this legislation system without any consideration of anyone else. Please vote to adopt refusal of the committee.
Further discussion on the motion to refuse to adopt the conference committee report for House File 2. I recognize the member from Scott, Representative Bakeberg.
Thank you, Mr. Speaker. Members, I rise to support the Damath motion to re-refer. I think I just want to circle back, though, and think about what is the problem we're trying to solve with this bill, but really this motion. And from this side of the aisle, the perspective that we have is we want to improve the bill. We want to make this bill better. And I think about, I look up in the gallery and I see a group of kids that just came in, not sure where they're from. And I, waving to them, and I think about the work that we do here, the decisions that we make today are going to impact those young men and women for generations to come. And I think it struck me as they walked in, and now this group walking in, that sometimes we can get in this debate and be talking about these policy provisions, but maybe lose sight of the why behind what we're doing. And I think about the issue that we're trying to solve. I think about some of the staff, the young staff that are starting out their families. And I think back to a couple years ago, I had a staff member who had their second child, and her leave was burnt up because of how the timeline worked with her first. A program like this would help someone like that. Or as I was driving in this morning, if you listen to KTIS radio, they're doing this thing honoring mothers right now. And really some heartwarming stories about moms. And there was a story this morning about a young couple who had, I believe, a 2-year-old child, and they had just had twins. Both of those twins were premature. One of them is receiving significant medical support and is in the NICU. This would support families like that. So I don't think there's a person in this chamber who doesn't think that this is a really important topic to be talking about and discussing. And we've talked a lot about the different concerns. And I think really at the high level for me, it's just that there's not collaboration. And it's not just with House File 2. It's one party, one perspective. And I've said it before, frankly, that's poor leadership. If I, as a leader, don't take input from my staff, that's poor leadership. Because we always come to better conclusions, better solutions when we sit down and talk to each other and we can say, man, I've never thought of that perspective. I see Representative Stephenson coming in right now, and from my understanding with talking with Representative West, the cannabis bill is an example of some good back and forth, sharpening each other. And when I look at House File 2, there's some concerns because initially we can say, oh, that's a great idea. I'm going to be able to be out on leave to care for or to support my family, but people don't understand some of the impact of that. And when I think about it from a school perspective, that's the lens that I obviously take, this is going to have an impact on our schools. It's also going to have an impact on our employees in the school. And this is what people, when I've talked about this, they don't understand that necessarily. So there's going to be a payroll tax, a 0.7% payroll tax, and that can be split between the employer and the employee, so 0.35, so just under 0.5%. And just on a very simple standpoint, that is going to cost one of my school district's employees, based off of last year's numbers, about $50,000 total for all of the employees at one of my school districts. It's going to cost the district about $50,000. Well, that's a teacher. That's a person that will lower class sizes by just off of this one mandate for 1 year. That does not take into account the additional costs, those costs that we don't always think about, like the substitute teacher, the administrative costs that we have to go through to hire those replacements, those long-term subs. And then I think the most important piece is the educational costs. So these kids that are now filing out, if they have a long-term sub in their classroom, that long-term sub is going to do the best job that they can do, but they're not the teacher that started the year with those kids, that know those kids. Whenever you have a substitute in a class, there's an impact. So there's an educational cost, and we can't quantify that with numbers. And what I continually hear from the schools that I work with is every little bit matters. Every little bit that we take away, Ben, it's only a 0.35% increase. That's okay. That's less that we have in the formula to be able to support kids. So what I would offer is that we send this back. We take the Dameth motion, and we take some of the components of the Mann family plan that Representative Baker brought up. Phenomenal plan. And I think one of the things that really jumps out to me is paid family medical leave doesn't start for 2 years. Till January 1st of 2026, because there's so much that has to be done. Well, the Mann family plan that the GOP offered, that starts January. By the time we come back to next session, the next time we're here, that plan would be up and running. The teachers that come back to school, and it happens every year, the teachers that come back to school and say, hey, Ben, just a heads up, don't tell anyone yet because I haven't shared with my colleagues, but I'm expecting and I'm due January 2nd. I would be able to say to that person, that's awesome, congratulations. Are you aware of the Mann family plan to support you? But I would have to wait 2 years till 2026 under paid family medical leave as it's currently proposed. For that reason only, if we truly care about our workers, we should send this back, get this right, so that we can do this. The Mann family plan is more flexible for our job creators, and it's more flexible for our workers. So I go back to those two stories I started with, that teacher who burnt through her sick time. Her husband works at a hospital, so he wasn't able to have time off. So which plan better meets the needs of that family? Or how about the family I heard about on KTIS radio this morning? That young family with a 2-year-old and their twins in the NICU. Paid family medical leave isn't going to support them, but we could get something in place to support families like them right away in a much quicker way. So I would strongly encourage, let's send this back. Let's get some bipartisan work done so that we can support and have strong families. We can support and have strong communities, and we can support and have strong schools. Thank you.
Further discussion on the motion to refuse to adopt the conference committee report for House File 2. I recognize the member from Wright, Representative O'Neill.
Thank you, Mr. Speaker and members. Well, this bill has had an interesting path. When it was on the floor last time, back on May 2nd, we made a whole lot of motions because this bill missed a whole lot of committee stops with a really important document, a 73-page document, the fiscal note. We spent a lot of time talking about the fiscal note and how many stops it had with no fiscal note. And Representative Scott, you made a motion to send it back to Judiciary because it had $315,000 on the fiscal note that you didn't get to discuss. Then Representative McDonald made a motion to send it back to Labor and Industry because it had a $1.5 million cost. That didn't prevail either. Neither of those prevailed. Then Representative Nash made a motion to send it back to state and local government. That one really should have prevailed because that fiscal cost was $53 million. So we're passing things through committees with no fiscal notes with an impact with as much as $53 million. But we don't know if that's even right either. Because when it did finally come to Ways and Means, and we had a fiscal note, apparently that fiscal note was wrong. And it wasn't just a little bit wrong, it was a lot wrong. And we didn't discover that until we were right here on the House floor. On Tuesday, May 2nd, we finally found out that no committees had an accurate fiscal note. Zero, none, not one committee had an accurate fiscal note. And we had to find that out on the House floor right here. We also had a motion by O'Driscoll, Representative O'Driscoll, to send it back to Commerce because it was just a $1 million cost. You know, it's funny how we members go, it's just $1 million, it's just $2 million, it's just $5 million. You know, it's so funny. If you ever said that in your home budget, you would that's just bonkers, Representative Ann New Brindley. That's bonkers. And then that brings me to actually Representative New Brindley, because you made a motion, Representative Brindley, to send it back to Human Services because it actually had a $4 million cost. And about the nursing homes too. And so none of those motions prevailed. But what I didn't say is Representative Daniels could have made a motion to send it back to Children and Families because that is a fiscal committee. And the only reason he didn't raise a concern about it is because there wasn't a fiscal cost. But you know what? Here's the thing about when you're sitting on a fiscal committee. You don't know what you don't know. And he had no idea that their fiscal note had been ordered. He had no idea if there was going to be a fiscal impact to children and families. None. So he could have made a motion to also send it back to Children and Families. But we didn't do that because when the fiscal note finally came in, even though it was inaccurate to Ways and Means, it didn't show a fiscal impact. This bill could not have been done worse. This is a terrible way to make law. And like I said this on another bill, we are making law illegally. You cannot do this. You cannot just keep skipping things. Oh, speaking of skipping things, let's talk about it skipping higher ed altogether. It has a massive impact on our two systems in higher ed, both the University of Minnesota system and the Min-State system. We never talked about it in higher ed. And I made a motion to send it back to higher ed, and none of these motions prevailed. Just in the higher ed system alone, it's 14 FTEs. That's a lot of FTEs. But it's not as many as setting up the program, which is 420 FTEs, which they could have talked about in all of those affected committees had they had the fiscal note, which they did not have the fiscal note. Now, I think really what was the most alarming for me, because I have been talking about process this entire session. I have never talked about process more in my entire career here, my 6 terms, than I have this session. I've never talked in Ways and Means as much about it or in Rules Committee, because bills have gone so quickly and haphazardly through this body that they have missed fiscal notes, they have skipped committees altogether. They've been rushed through, and this is the worst example I have seen this session of a rushed bill. If any bill should go back to conference committee and actually do a thorough vetting, it is this one. This impacts every single employee in the state of Minnesota and every single employer who has an employee, every single one. Every school district, every city, every county, every police department, every small business, every big business, every nonprofit. If you have one employee, this affects you. Let me just bring to your attention, you don't even have this anymore because it doesn't even exist online. Thank goodness I printed it out and kept it in my notes, because this fiscal note doesn't even exist anymore. It was literally written over and called a revision. So this isn't even publicly available anymore. That's just lovely. I can't even believe that's true, but it is true. And I had read into the record last time we talked about this on May 2nd, the error, apparently, I found out after the fact, on page 54. And Representative Richardson said, oh, well, that's just an error. That was just an error in the fiscal note. That's how quickly these things are being rushed through. We literally went through Ways and Means, the last fiscal stop, the last stop till it comes to the floor. Can't really count rules because we're just calendaring the bill. We can't talk about anything except process, as Representative Long likes to remind me, because I don't talk about anything but process and rules, but I certainly have talked a lot this session. But just to show you how rushed this is what was in the original fiscal note that we had in Ways and Means. And it says that separate accounts will be created for each employer to record premium payments into the account and benefits out of the account. Beginning in 2027, each employer's premium rate will be adjusted to the rate that maintains at least 1.45 times the amount dispersed from that employer's account in the previous year ending in September 30th. And annual premiums will be adjusted according to that. Sorry, Mr. Speaker, I did not ask for that. I'm so sorry, Mr. Speaker. Now I got to get back to my train of thought. So, Mr. Speaker and members, this fiscal note, we found out on the House floor, was completely and utterly inaccurate. And what it said was that each individual employer has their own each individual account, which probably will be true once you set up this monstrosity. And then whatever money goes in and whatever money goes out is specifically tracked, and that's probably true too. But it said that whatever came out in the previous year, you had to have 1.45 times, so 45% more than what was taken out in the previous year. And I went through the whole thing of, well, what if you've only got 5 employees and one employee takes 24 weeks? Because you know what the conference committee did is they actually reduced 24 possible weeks down to 20. So you get, there was a little give there, just a little bit of flexibility. Not enough, I would say, for an employer that has 1 employee or 2 or 3 or 4 or 5 employees. But in any case, so if you've got, say, 5 employees and one of them goes on maternity leave, the way that it was, when it left this floor, you could take 12 weeks maternity and then you could take another 12 weeks of bonding. That's what the bill says, bonding. So that's 24 weeks. Now that's been reduced to 20 in the conference committee report. But that's an awful lot of money coming out of that account. Now I was told that that's not the way it works and that was just an error in how it was written. But that tells you how rushed this bill was. And it's still really rushed. There are so many problems with this that need to get fixed in the conference committee. Oh yeah, and then the conference committee has 0 Republicans on it again. None. 0. Absolutely 0. So I'm not really sure what we're trying to accomplish here. There were a handful of conference committees that actually had Republicans assigned to them. And I do mean a handful. And then, like, if my brother, Representative Daniels, was on the floor, you know what happened to him. We had a long, protracted conversation about that. And finally, an apology came to him personally. And then finally, he was included in the conference committee process. He was allowed to offer his amendments that we heard on the House floor that, well, he didn't bring them. Well, when was he supposed to bring them? When? When they were not quite done going through side-by-sides? When they were behind closed doors in secret rooms making big deals? When was he supposed to do that? So we sent that bill back, and they actually had a public hearing and public discussion, and they actually he got to offer some amendments, which of course were all rejected, which is really sad because one of them was really important to the deaf community here in Minneapolis and St. Paul. So that's really sad that that was rejected. But honestly, this whole session has been incredibly sad. The trifecta has done what they wanted to do. They have done everything that they want to do. And I'm sure they're back in private rooms right now making more decisions without the public knowing, without members knowing. A consolidation of power. That's what this has been. It's been a long, long process of consolidation of power. Skipping committees, not having fiscal notes, not having public disclosure, not having public input. One bill after another, but this is the king of the bills. This is the king of the bad bills. This will hurt Minnesotans the most. And I know you think that you're helping Minnesotans. But even in conference committee, you can see that there are vast concerns. There are massive concerns about this bill. And how do I know that? Because in the conference committee, you agreed to cap the payroll tax at 1.2%. I don't know how long that cap will last because I don't think that's even realistic. When you talk about the usage that will come, and who wouldn't use it? You know, if I could take 12 weeks off to take care of my grandchildren, and you all know about my grandchild Avery, who was at Children's Hospital for the first 8 months of her life, and I spent a lot of time at Children's Hospital with my little grandbaby that almost didn't make it 4 times. She had heart attack and strokes, and I'm sure any mother, grandmother, auntie, uncle, cousin, sibling would love to go and do that. Who wouldn't use this? Who wouldn't use this benefit? Absolutely, people are going to use it. And I think that even in this fiscal note, the estimations of usage is incredibly low. Somewhere around 5%. That is completely and utterly unrealistic. And all you have to do is look at the other side, and you see that you could take it for almost anything. And there's almost no verification. I think something was added in, like if the employer finds out that you're lying about your usage, he can fire you. So now we're going to make employers be the punitive agent for someone that's abusing and misusing this fund. That's atrocious. It's inconceivable. Inconceivable that we would do that to our employers. There are so many problems with this bill. Like I said, it is the king of the bad bills this session. This absolutely has to go back to conference committee, and I don't even think with the entire time we have left of session that this bill can be fixed in conference committee. It really needs to go back. And I am absolutely dead serious. This absolutely needs to go back to the real committees of jurisdiction and talk about this in a real way with real public input and real numbers. If this fiscal note was so rushed through that even here on the House floor we were finding out that the fiscal note for Ways and Means had major errors in it, not little errors, not tiny, a misspelling, a comma, a period, an and or an or. No, it was massive errors. And if the people putting this together are that confused about it, then we need a lot more conversation about this. I don't even think conference committee is the place to even do this. I think this needs to go, it just needs to be tabled and dealt with next session because this is absolutely not ready. I don't even know why we're rushing this through. You move the enactment date. You moved it out 6 months. It doesn't get enacted effective until January 1 of 2026. What are we doing? Why are we even doing this bill today? Is it so we can have a press conference? I don't know. What is the point of this? We could do it and do it right and have public input and have real numbers and not rush through and go through every committee it needs to go through with all of the information, with all the fiscal impact that's actually real, and we can actually help Minnesotans. I don't know if Representative Baker is going to speak, but he has a plan. We talked about it. I'll let him talk about it, but there are other ways to do this. This certainly is not the way to do it. So members, I hope that you would support the motion to refuse to adopt this, send it back to conference committee. I mean, it'd be even better if we just tabled this and worked on it next session, because it is absolutely not ready. There's so many problems with this. This is going to be incredibly expensive to business, incredibly expensive to every employee who has a huge payroll tax. There isn't hardly anything when it comes to checks and balances. You know, I mean, you could literally have grandma in Florida say, I need help, and have 50 different people fly to Florida for 12 weeks to go take care of grandma. There are no checks and balances. Nobody is watching this at all. With 420 employees setting this up, there's still nobody to even verify any of this stuff. You're going to make the employer check on their employees to see if they're lying about what they're using it for? Come on. Send it back to conference committee. Let's do this right. Or better yet, just table it and let's do this next session. Thank you, Mr. Speaker.
Further discussion on the motion to refuse to adopt the conference committee report for House File Number 2. I recognize the member from Meeker, Representative Erdahl.
Thank you, Mr. Speaker and members. Time to get a little more vim and vigor into this thing. Dragging a little bit. All right, we need to send this back. We need to refuse to adopt. We can make this better. Mamma mia, we can make this better. The implication of impact are not thought out. We don't need to mandate 65 mandates to our school districts. I have a school with a better plan. What do? Switch to this one and leave the good plan? In education, $7.2 billion is paid in salary and wages. At 7% payroll tax, that's $50 million. Oof to me. For my bold school district, that's $142,000. A big dent in a small school budget. Taking money from schools. Now, I could go through all kinds of other examples of what we're doing here, you guys over here are doing, with other fees and taxes that are being increased. My gosh, it's like piracy. Have you considered, you'd make wonderful Dread Pirate Roberts. Now, I did contact a superintendent who said this to me. This bill would allow our employees their accrued leave balances in lieu of family medical leave programs. If that's the case, we essentially will still be paying the full salary of the employee. The sub-costs, as well as still having to pay the payroll tax. This bill essentially does not help our employees, but rather uses public school districts to fund private programs. School districts should be excluded, and that's one thing that we should send this back to have considered. We need to hammer the point of unfunded mandates and the cost to our school districts. Now, it's tough to sit through all this and speaker after speaker talking about this, but it's important to hear. Sometimes I wish we could just skip to the end and say no to the pain. But it's an important message that needs to get out. We should send this back. We should refuse to adopt. It hurts our school districts. It's another mandate. Thank you.
Further discussion on the motion to refuse to adopt the conference committee report for House File 2. I recognize the member from Douglas, Representative Franzen.
Thank you, Mr. Speaker and members. So I too stand for the Damith motion to refuse to adopt. Friends, we seem to have an issue in this body of lack of cooperation. lack of working together. Many of us grew up in an era where we watched Sesame Street. One of my favorite Sesame Street songs was called Cooperation Makes It Happen. Probably remember that. I don't have a great voice unless I'm singing karaoke, and we didn't start the fire, which, as I've said before, I truly wish Billy Joel would update his lyrics to that, because we have so much more to offer that song. But anyway, so the verse goes, cooperation makes it happen. Cooperation, working together. So you got these Muppets, right? And it goes, I saw these crazy dudes and they went out on the street. They were cleaning out the empty lot and making it neat. I said, man, this is cool. What are you trying to do? They said, making a garden for me and for you. The legislative process is like making a garden. We offer ideas, put those ideas in a bill. The chair decides of that committee if they want to bring that bill idea forward. And we work together to bring that vision to fruition. So the Muppets, they go, hey man, join us, come on, let's go. Together we can make a pretty garden grow. And together this body can make a bill, an idea, better when we put all of our heads together and work collaboratively. The girl says, I'll dig a hole. The guy says, I'll plant a seed. Together they sing, and we can add the water and all growing things need. Bills need all of our input because we all have different perspectives that can make that bill idea grow better. And then the verse goes, cooperation makes it happen. Working together, dig it. And the scene changes. Now they're in front of a building with two other Muppets, and they're in the shade. Now we friends were on the corner hanging out. I said, hey, you can hang around these garbage cans some other day. They said, man, is this cool? What are you trying to do? I said, make a street garden for me and for you. We are not asking to just hang around and be lazy. We want to be engaged in this process. Now, fun fact, this is my 13th year. I have never once been on a conference committee. I'm not sad about that because I know that there are many others in this building, in this chamber, that absolutely love being on a conference committee. And when those Republican members are named to be on the conference committee, I always shout out, you'll probably hear it, congratulations, you've done it. You were on the conference committee. Why? Because people love being engaged and being part of the process. So back to cooperation makes it happen. The verse continues on. Hey cats, join us. Come on, let's go. We'll all cooperate and make a garden grow. You dig a hole and I'll plant a seed, and we will add the water that all growing things need. A verse goes, cooperation makes it happen. Cooperation, working together. So back to the body. If we all cooperate together, we can make this bill idea better. And we can address the needs that are being brought up here on the House floor simply by bringing it back to the conference committee and including the ideas the minority has. So now they're back in the garden where the plants have begun to grow. The Muppets are in the shade. Continues on now. Now we watch our garden grow, and we come back every day, and the people in our neighborhood come round and say, there's two friends now, hey man, this is cool. Tell us what we can do to keep this pretty garden here for me and for you. Everybody else sings. We all say, hey, join us. Come on, dig the scene. We'll all cooperate and keep our garden green. The girl says, you trim the leaves. The guy says, and you pull the weeds. The girl says, I will add the water that all growing things need. Back to the verse, cooperation makes it happen. Cooperation, working together. Friends, they came together. They grew a garden cooperatively. Just like this body is trying to grow the best paid family medical leave bill possible. But it needs all of our ideas in order to do that. The current bill is lacking. It will crush every Main Street job sector in this state. There's a payroll tax reverted back to 1.2%, which it was at a 1%. Friends, everywhere we go right now in this body, in this capital, we are making it so much harder for employees and employers. Wage theft is happening legally because Democrats have an insatiable appetite for growing government, and then they come to the taxpayer and say, well, I'm just going to have to take it out of your paycheck. I'm going to have to take it out of your wallet. You're going to have less money for your family, but more money is needed for government. You deleted a language where the commissioner where if the commissioner has probable cause that an applicant or an employer has fraudulently obtained benefits, they must refer the case to the county attorney of jurisdiction. That language is gone. So there are no safeguards to prevent people from being fraudulent. And you call the payroll taxes premiums as if to hide from the public that they are going to have money taken out of their paycheck to fund this new massive government-run program. As was stated before, it's going to require a new IT system built from the ground up, from scratch. And we have a track record in Minnesota of not being able to do what is required when it comes to IT systems. A big fail. We're going to dump millions and millions and millions of dollars, and it's going to be a massive failure. So if this bill is not taken back to conference committee, I'm afraid that there's going to be a lot of I told you so's. Years of development and over 400 new government employees. Over 400 more government employees to run this one program. And then you got that 0.7% payroll tax, which I think is wage theft. Wage theft. You're all against wage theft unless it's for a government program or some thing you want to fund, which now I'm hearing that Democrats would like to raise the gas tax. So that's just more wage theft. Let's see. And the tax is going to be regressive, okay? So you have a steeper hike for lower paid than higher paid workers. Someone earning $30,000 annually would see a 23% increase in their state tax liability. For a worker earning $100,000, the hike would be 13%. So you say you want to tax the rich. Tax the rich, tax the rich. They make too much money, tax the rich. But what you're really doing is you are taxing those who cannot afford to pay more. You are bleeding the middle class dry. And then you assure us, if you like your paid family and medical leave plan, you can keep it. Well, that sounds really familiar. I remember that with Obamacare. If you like your insurance, you can keep your insurance. Well, that kind of turned out to be a farce for many people. And then if that business did want to keep their insurance plan, though, this government, the House and Senate Democrats, make it super difficult to do so. Very difficult. You'd have to pay an accounting fee, and you would need to offer their own benefits that are at least on par with the state's program. So if the state's program is at this level, that little business who already offers their own version of a paid medical leave family plan would also have to have it at that same level. This means restrictions on when employees can take leave and how employers should treat employees who do, among others. Private benefit programs will be overseen by a commissioner who will have the power to terminate such programs if they violate the rules. So if government doesn't like what you're doing, guess what? You're done, terminated. You're going to have to offer the state-run program because we, the government, don't like what you are offering, little business. You know who can afford this stuff is big business, big corporations, the same corporations that were rewarded during COVID shutdowns. You get to stay open, big corporations. Little small business, little ma-pa, Main Street businesses there, you have to close down. And during those COVID shutdowns, during that time, you know whose wages increased? Were the CEOs of the big businesses. Now, big business really doesn't care about this bill. I don't think so. They got the funds to fund it, right? It's still going to come out of the employees' paychecks, blah, blah, blah. They've got attorneys. They've got people to handle the paperwork. They'll just hire some more people to do that. They'll raise prices on whatever they're offering. The public will pay more. But for the small business, they're not going to be able to do that. You know, in one of my committees, the Sustainable Infrastructure Committee, which still to this day I'm really not sure what that committee was about, we had a lot of discussion about our small cities and the inability for many of them to do paperwork for grants, for the federal dollars that are coming down. Spent a lot of time talking about setting up grant programs for these cities to be able to apply so that they could hire grant writers and such and such. But then on the other hand, you're like, hey, small business, you're gonna have to do all this paperwork, and if you don't do it correctly, we are going to fine you. So violations, warranting terminations could be as minor as the business failing to provide reports, and in addition, employers face penalties for record keeping and other violations of up to $10,000, which of course, very few, in my opinion, big corporations are going to have this problem because they have a whole slew of attorneys that will make sure that the rules are being followed. But gee whiz, the small business owner, if they don't dot the T, don't put a period at the end of the sentence, don't do something that government says they're supposed to do, they're going to be hit with a fine upwards of $10,000. It's really awesome. Sarcastic awesome, that is. Needless to say, the burden of complying with these regulations, as I said, will rest most heavily on the state's smaller businesses. That's crazy. It's a one-size-fits-all approach that will construct an expensive, invasive, over-engineered hammer to crack a relatively small nut. You are increasing taxes on every single employer, including private employers, nonprofit, cities, counties, and school districts. But gee whiz, those small cities and counties, they can't afford to or don't know how to do paperwork to apply for a grant for federal dollars, but we're going to expect them to follow through with this and make sure everything is freaking perfect, or they're going to be hit with a fine for up to $10,000. And then, of course, Let's talk about childcare costs. Oh, childcare is so expensive. We're running out of childcare providers. What are we going to do with all the kids? There's nobody to watch the children. It's hard for people to go into work because there's no spaces, which is all true. Okay, that is all true. But this bill adds costs to the childcare providers. They are already facing high regulatory costs, and this drives up childcare rates without adding available revenue to raise childcare wages. Do you think that's fair? Do you think that's progress? I don't think it's progress. I don't think it's fair. But then I suppose maybe next year, a year or 2 years from now, you're going to swoop in with some more government money and say, hey, child care providers, here's some more money for you. So you can rescue them. So you can say, hey, look at what we've done. Pat ourselves on the back. You're transferring $1,700,000,000. You're transferring from the general fund to the Commissioner of Deed to transfer to the Family and Medical Insurance Benefit account. All poor nursing homes, A, they're not going to be able to afford this mandate, and B, this body, when the bill, the Human Service Bill passed out of this chamber, this body, the Democrats, funded nursing homes at $3.9 million. When we know that across the state, nursing homes are closing. Nursing homes are on a thin thread in some areas of the state, wondering if they're going to be able to manage to stay open next month. But yet, in this bill, House File 2, you are transferring from the general fund $1,700,000,000 to start this new government-run program. So, friends, cooperation makes it happen. Send House File 2 back to the committee and include a Republican voice to make the bill better. Mr. Speaker, I think that is prudent. It is not unreasonable. There's still plenty of time in the legislative session to get this done. Send House File 2 back to the committee. Members, vote to refuse to adopt. Thank you.
Further discussion on the motion to refuse to adopt the Conference Committee report for House File 2. I recognize the member for Isanti, Representative Johnson.
Mr. Speaker, members, we need to send this back. We need to make sure that all the voices of Minnesota are heard. We have this side of the aisle is completely shut out, which represents over 2,700,000 Minnesotans, and a lot of them small business owners. Small business owners were left out of this. There's a mandate on them that they didn't have a chance to talk about. Over 80% of our employers are small business owners. Most of them 5 employees or less. This is going to be a huge drain on them, doing the paperwork, doing the payroll stuff. And for those of you that at home that don't understand, this is also a payroll deduction on your paycheck. You're going to be paying for this, not only on your paycheck, but it's also going to be an increased cost to the business that you work for, which is going to be passed on to the consumer. So when you go buy something, you're going to pay more for it. This program comes out of your pocket. Our small businesses across this state and in greater Minnesota, most of our businesses are small. We have our small mom and pop shops in our small towns. That's where we buy our stuff. And if they don't shut down, we got to drive farther to go get it. And I just heard today that they're looking at increasing the gas tax by attaching it to inflation. Automatic inflator on our gas tax. While we're already raising taxes about $10 million on top of a almost $19 billion surplus. It boggles the mind when you have that much surplus and you got to raise taxes. And most of the people that are going to pay these taxes are our middle income and lower income people. It hits them the hardest. And those are the people that the other side of the aisle says they stand for. That's poppycock. Doing everything you can to hurt them, to make them dependent on you. Nothing to bring them up, everything to keep them down. But there again, it's going to hurt small businesses big time. And that's going to hurt the greatest part of Minnesota, the 80 counties outside of the 7-county metro area, which was shut out on this conference committee and not given a voice. That's why it needs to go back to conference committee on the DeMuth motion. Now, it was interesting, earlier this week I found an article. For those of you who live in Minneapolis and represent that area, I don't know if you're aware of this, but in the last 2 years, 2.5 years, you've had 1,400 businesses leave or shut down in the city of Minneapolis. And that's a report from the United States Postal Service, where they're no longer delivering the mail to that business in Minneapolis. 1,400 employers gone. I have no idea how many jobs that was, but I'm sure it was a lot. It's fun watching some of the people over on the other side of the aisle laughing at that. It's disappointing. It's a serious issue. I got a email from one of my school superintendents of the 7 school districts I represent with the stuff that this body is putting on our school district alone. Even though you did 4 and 2 on the formula yesterday, which brought in about a little over $7 million to one of those districts, the other stuff you're putting on it is costing them almost $13 million on top of that. So what your bill did yesterday and the other stuff that we've done is a $5 million+ deficit to that school district. And they were on the edge of having the state take over already because of funding. You should be ashamed of what you're doing. It's no wonder that this body of the legislature, the House and Senate, have such poor ratings in the polling. Because we're doing everything, I should say, you're doing everything that is hurting this state, hurting the citizens of Minnesota. Yes, is it good? A good program? Representative Baker had a great one that works much better at almost no cost to the state, and it could be up and running by the end of this year. Yet you said no. Yeah, you're working for the citizens of Minnesota. unfortunately. And our polling numbers are going to keep going down because of what the majority is doing to this state. It was really interesting yesterday listening, I believe it was yesterday, everything's mixing together. No, it was earlier this morning on a bill. Hearing the talk about it, about the negotiations, about how the three bodies work together. Let's see, there's the House and the Senate. I can't figure out where that third body is unless you're bringing in the executive branch into your negotiations that we don't know about. The House and the Senate send stuff to the governor. He says yes or no. This body and the other body decide what's sent to the governor, not the governor telling us what we're going to do. If we're going to have that, we might as well just leave, go home, and sine die now. Let's just send this back under the Demuth motion, get it done properly, get everybody involved, get the small businesses involved, because that's our largest employers. It was mentioned earlier that 80% of large businesses that are in the chamber have this program. They can afford it. If you have 5,000 employees and one or two are gone on this program, it doesn't affect them that much. But if you have 2 or 3 employees and one goes, that's 30% of your employees at one time. That hurts. It hurts the business. It's time to look at everything and making sure that we don't hurt anybody on a program. Send this back where it belongs and get it fixed correctly so that everybody is representative in the negotiations. Thank you.
I recognize the member from Hennepin, the Majority Leader, Representative Long.
Mr. Speaker, I move that Conference Committee report to House File Number 2 be laid on the table.
Representative Long moves that the conference report on House File 2 be laid on the table. All those in favor, please say aye.
Aye.
Those opposed, please say no. The motion prevails, and the conference report on House File 2 is laid on the table. I recognize the member from Hennepin, the Majority Leader, Representative Long.
Mr. Speaker, I move that the report of the Conference Committee on House File Number 2310 be taken from the table.
Representative Long moves that the report on the conference committee on House File 2310 be taken from the table. All those in favor, please say aye.
Aye.
Those opposed, please say no. The motion prevails, and the conference committee report on House File 2310 has been taken from the table. Members, we are now on the Heinzman point of order. I recognize the member from Crow Wing, Representative Heinzman.
Thank you, Mr. Speaker. I withdraw my point of order.
Representative Heinzman withdraws his point of order. There's a motion at the desk. The clerk will report the motion.
Heinzman moves that the House refuse to adopt the report of the Conference Committee on House File number 2310 and that the bill be returned to the Conference Committee.
I recognize the maker of the motion, the member from Crow Wing, Representative Heinzman.
Thank you, Mr. Speaker. That is my motion, and I would go ahead and send this back.
Is there any further discussion on Representative Heinzman's motion? I recognize the member from Hennepin, the Majority Leader, Representative Long.
Thank you, Mr. Speaker. I ask members to support the motion, and I ask for a roll call.
Representative Long requests a roll call vote. Are there 15 hands? Seeing 15 hands, there will be a roll call vote. The clerk will take the roll on the Representative Heinzman motion that the House refuse to adopt the report on the Conference Committee on House File 2310 and that the bill be returned to the Conference Committee. The clerk will take the roll. The clerk will close the roll. There being 129 ayes and 0 nays, the motion prevails, and the report of the Conference Committee on House File 2310 will be returned to Conference Committee. I recognize the member from Hennepin, the Majority Leader, Representative Long.
Mr. Speaker, I move that the report on Conference Committee on House File number 2 be taken from the table.
Representative Long moves that the report of the Conference Committee on House File 2 be taken from the table. All those in favor, please say aye. Aye. Those opposed, please say no. The motion prevails, and House File 2 is taken from the table. Members, we are back on the motion to refuse to adopt the report of the Conference Committee on House File 2 that was authored by Representative Dameth. We are on that discussion of that motion, and I recognize the member From Isanti, Representative Dowd.
Thank you, Mr. Speaker and members. Appreciate the opportunity to speak on this bill. I will be consistently brief, and no, I actually will this time. But I did want to point out that this is just another example of one of those bills and ideas from the Democrats that they spend too much time with their heart and not enough time with their brain. This one just doesn't work. It may feel good, but it doesn't work. And you maybe were advised by people in your life that if something feels good, you probably shouldn't do it. This is a good example of that. Now, I'll walk you through just a basic math lesson on this bill.
Members, please take your conversations off of the House floor into the retiring room or the rotunda. Representative Dowd.
Thank you, Mr. Speaker. Appreciate that. Just a basic math lesson on this bill. I think there's a 0.7% payroll tax in the bill, or 0.7% that's split between the employee and the employer to fund this program. So 0.7% of wages on all Minnesotans, 0.7, less than 1%, is going to pay for a benefit for every worker and allow them to take to up to 40% of their employment off during a year. So every employee is eligible, and they can take up to 40% of their working year off, and we're taxing the wages at less than 1% to cover all that. Anybody paying attention? I remember when I was a kid, I used to play, if there was a deck of cards laying around, I used to love to make a house of cards. I was pretty good at it too. I could set them up in just a way and then try to see how many you could stack on top before it would collapse. I never had one that didn't collapse. They always collapse. And this, for my colleagues on the other side of the aisle, this program is a house of cards. I understand it's really great to be able to say to the public, hey, we're going to pass this program that's going to allow you to take 20 weeks of paid time off each year. The bad news for the employers is you are paying for this. So at a time when we have a $17.5 billion surplus in our state budget, this is a payroll tax. So this is taxing every worker in the state of Minnesota. This is taxing you, taking money out of your paycheck to pay for something, in a lot of cases, that you already have. So many employees across the state already have this benefit, and they don't pay a dime for it. Their employers offer it without taking any money from the employee. But now, government is going to make sure that we take money from those employees that are already receiving this benefit to pay for something they already get. And if you haven't figured out the math yet, we're going to charge less than 1%. And by the way, this is capped at, I think it's 1.2% in the bill now. So the bill's going out with 0.7. That's going to be the set rate. And then the commissioner can increase that up to 1.2. By the way, and based on previous performance, we can say this with 100% certainty, it will be at 1.2 within 15 minutes of the governor signing the bill. It'll just be at 1.2. Whatever the cap is, that's what it will be. They will take absolutely the maximum needed to operate the program. This will create a new bureaucracy here in the state where they will hire probably at a minimum of 400 employees to operate this program. And think MNsure. If the last time we created a huge new bureaucracy at the state was MNsure. And what MNsure did, I'll just remind you, is it was a website that allowed people to look at and purchase a health insurance program that was already commercially available. And MNsure itself doesn't offer any health insurance, and it doesn't insure anyone. It only is a website that allows you to look at and choose an insurance product that already exists in the marketplace. So that's what MNsure was. The state of Minnesota spent $400 million on MNsure, which is a website that allows you to choose insurance. Not one person gained insurance from MNsure. Not one person was insured by a product that MNsure offers, not a single person. It's simply a government bureaucracy. $400 million. The state of Utah did the same thing for $600,000. So Minnesota, $400 million. The state of Utah, same thing, $600,000. Okay? I don't trust the state with 0.7% of every employee's wages in the state of Minnesota. I do not trust the state. And the promise they're making to you is they're going to take less than 1% of your wages, and they're going to promise every employee in the state up to 20 weeks off, which is 40% of your year off with paid wages. How does that work, my friends? They're going to collect 0.7% from you and guarantee you 40%. I don't know about you, but my mama didn't raise a fool. There is no chance that works, and this thing needs to go back. So members, please vote. And one more thing I want to say. This is another example of exactly what Democrats have been doing on everything. They certainly don't understand a free market economy and the way that that works. It was Ronald Reagan who said, if you want more of something, incentivize it. If you want less of something, tax it. And what this bill does is it taxes work and it incentivizes people not to work. And the biggest problem right now in the state and in this country that faces Minnesotans that was 100% created by Democrats is inflation. The highest inflation in a lifetime. And the problem that we face and the thing that created inflation wasn't that people were working too hard. It wasn't that people were getting paid too much. It was that this government paid people too much not to work. So the answer isn't paying people more not to work. The answer is letting this job economy right now, where anyone who wants a job can get one, and anybody who needs a better job can get one. And if employers need to offer a greater benefit set to get employees, this is exactly the sort of thing they will have to offer. And they already are, because the free market is demanding it. And they're paying for it 100% without Democrats taking 0.7 of your pay out of your paycheck. Because that's what this is. At a time when we have the highest surplus in state history, actually more than double the highest surplus in state history, Democrats, and this isn't even counted in the $17.5 billion surplus and the $9.5 billion of additional tax increases. And for whichever member of my side of the aisle that said earlier, gosh, I don't know why they pushed this out another year. The reason they pushed it out another year is so that the tax increase on Minnesotans doesn't show up in the fiscal notes for this biennium. This is a huge tax increase, and it's a tax increase on workers. Every worker in the state of Minnesota is getting a huge tax increase because of this bill, which will not work. It's bad policy, and it's ill-advised to proceed with this. So we need to send this bill back to conference committee and refuse to adopt conference committee report. Please vote in favor of this motion.
Further discussion on the motion to refuse to adopt the conference committee report for House File 2. I recognize the member from Todd, Representative Wiener.
Thank you, Mr. Speaker. Once again, we get to talk about tabling another bill, send it back to conference committee. Like the Pointer Sisters song, I am so excited. We need to pump the brakes on this thing a little bit. And I know things are moving fast. I know things are getting close to the deadlines here. But like Pedro from Napoleon Dynamite said, if you vote for me, your wildest dreams will come true. And is that what happened this last election cycle? Is that the campaign promises we told voters? I don't think so. We need to step back, we need to take a breath. Like Taylor Swift said, we need to shake it off. Send this back to committee. Let's have a discussion. Let's take some time. It's not the end of the world. It's better to take just a breath. Slow down. From the movie Shawshank Redemption, they said, the world went and got itself in a big dang hurry. And that's what we're doing here today. Again, we're in a big dang hurry. So why? You got the power, you got the votes, you got the control. It's not winners take all like the ABBA song. We can do this. Just give it time. So I don't want to drag this on forever. I do like movie quotes, I do like songs, so I've slipped a few of these in today. But this one's a little bit tougher. Gretchen Wieners from the movie Mean Girls. I don't think my father, the inventor of toaster strudel, would be too pleased to hear about this. It's hard to fit that into a speech on the floor, but it's possible. And I bring up my father a lot. He was a good man. You know, we talk about how family is important. He was a business owner. Think the world of him. He's been gone about 14 years now. But those lessons that we learn, and in our youth, we are so excited to get things done. We want to push things through. Just take a breath. Some interesting numbers that go along with this bill. We want to help people out. I understand that 80,000 or 80% of businesses already supply paid family leave, which is amazing. It's great. Small percentage that don't. There's another number here that has not been discussed. 780 million hours of vacation time in 2018, 2019 never got used. That is an incredible number. Because as Americans, we are workers. We are excited to work. We are industrious. We are entrepreneurs. But what kills that entrepreneurial spirit, that ambition? More taxes, more government control. Send this thing back. It's inconceivable that we're having this discussion again. So let's just take some time, chill out like the Big Lebowski. The dude abides. Thank you.
Further discussion on the motion to refuse to adopt the Conference Committee report for House File 2. I recognize the member from Anoka, Representative Niska.
Thank you, Mr. Speaker and members, and thank you, Representative Wiener. You said it's inconceivable that we're having this debate again. Respectfully, I don't think you know what that word means. We just have the same debate over and over again. This is kind of deja vu all over again for me. Stop me if you've heard this story before. We bring forward a common sense amendment. I bring forward a common sense amendment. Folks on the other side say, yeah, this is a good amendment. Let's take it. And we go to an all-DFL conference committee, and it's gone. It's gone. That's what happened here, and it's a tragedy that's going to hurt the very workers that we're trying to help. Because as Representative Dowd explained, this is what we're doing is we're taking a payroll tax out of the paychecks of workers, the very workers we're trying to help. We're starting it at 0.7%, and it could go all the way up to 1.2%. We're saying that split 50-50 between the employee and the employer. The problem with that analysis is that every study that's been done about this shows that when you do have a payroll tax nominally paid by the employer, it ends up being paid by the employee. And the reason for that's pretty simple. There is no magic money tree. There is no magic money tree. Despite what we might have heard in some committees this year, there is no magic money tree. And so when you tell employers that they have to pay a certain amount of money as part of the compensation for an employee, it ends up coming out of the compensation they can offer for that employee. And so we have to be very concerned about what that tax is going to be, what that premium is going to be, and what happens when people fraudulently obtain benefits from that pool is that every worker that we're dealing with gets hurt. And so the amendment that I offered that was accepted in this House On a unanimous vote, maybe I should have called for a roll call. If I had called for a roll call, maybe it would have been adopted 126-0. But we didn't call for a roll call because we thought we could take the majority at their word that they were taking the amendment. And the amendment was very simple. It said that when the deed commissioner has probable cause that someone is obtaining benefits fraudulently, that they're going to refer that to the county attorney for prosecution. When I was offering that, I did offer the suggestion that we should maybe create a more specific criminal penalty. To the credit of the conference committee, they did do that part. They did create a more specific criminal penalty, but they left out the part about making sure that the deed commissioner and the department are put on notice and instructed that we think that if they do find some kind of criminal fraud, that they should report that to the county attorney for prosecution. Very simple amendment, common sense amendment. I don't know why the conference committee didn't do it. We should send this back just so they can do that common sense amendment. Make sure that workers who are paying into this program are fully protected against that pool being defrauded. And because when that pool is defrauded, every worker that pays into this thing is defrauded because their taxes are going to go up, the tax that both they themselves are directly paying and that they are indirectly paying because of their employer being charged. And so I think we should vote yes on the Dameth motion and send this back to conference committee. Thank you.
Further discussion on the motion to refuse to adopt the conference committee report for House File 2. I recognize the member from Dakota, Representative Hudella.
Thank you, Mr. Speaker. Members, this is just another bill where the minority voice is not being heard. These walls are funny, don't you know? It seems like most days these walls listen to us more than the majority does. My constituents do not have a voice up here. They don't. That's the reality of it. They didn't vote for Pedro. They voted for me, and yet they don't have a voice here. It's incredibly frustrating. And like Representative Wiener stated, it's like the DFL went out and got in a big dang hurry and is getting it all wrong. But I get it. Your team won. You won. And if you're not first, you're last. But not a day goes by that I don't feel regret. Because this is more than just a flesh wound. It hurts. It hurts our constituents' faith in how we do our process up here. Oofda. Now, as bill authors, sometimes it's easy to believe that everything you do is magic. But it takes both sides. It really does. And we are definitely not in a scenario, Representative Wiener, where the dude abides and includes both sides. It's not happening. It's just not happening up here. So here we are, like Representative Swedzinski said, Tuesday's gone. It's Wednesday. And by the way, I thought we wore pink on Wednesdays here, but I'm confusing that with green in the cannabis bill. But that's not important right now. All I know is session is almost done, and I'm so excited because this is definitely not Mr. Rogers' neighborhood up here where we talk with and work with each other. It has been a one-way trolley track all session long. So I am not even going to bother speaking to the actual points on this bill because, as I said, our voice is not heard. So members, please vote to send this back to committee. Thank you.
Further discussion. I recognize the member from Otter Tail, Representative Murphy.
Thank you, Mr. Speaker. I think we need to send this back too. I just want to talk about some of the conversations I've had with people in my district. And, I've been in business for 31 years, and so I really love to talk to businesses about their businesses, how they started, what their challenges are, and they love talking about their businesses. We talked about small business. Representative Altendorf mentioned, the 2 and 3 employee business. There's a lot of those businesses. This is going to be a major stress for them. I talked about the first employee. I can remember my first employee, and there's a lot that goes into that. You have to train them, you have to spend time. They need to work hard for you in order for it to pay. And so that first employee is a big deal. And this is going to be hard on that. It really goes back all the way back to the beginning. And as an employer that's just starting out, it's going to be really hard to want to do that. When you look at larger employers, I've got some larger employers in my area, and one of them does some really amazing things. I mean, they do a lot of community support. And they said, Tom, we're not going to be able to do that same amount if this goes through. We just need to spread it out. So some of the things that they really prided themselves on doing was creating great communities. And we have great communities up in my area. I mean, if you go up to Ottertail County, you'll know what I'm talking about. They're great communities. They really do things differently. Their streets are different. I was walking in a small town in my area, and I parked 2 blocks off of Main Street. And I said, what's going on in town today? He said, nothing. It's just Saturday. The business was full of people. The streets were full. And that's because it's the community, and the community really bonds together. A couple employers that I talked to that told me about what the stresses were going to be in the paid leave provisions. They said one was a guy that he delivers your gas to gas stations. He's got 11 CDL drivers. CDL drivers, they take a little bit extra time and being able to put them on the road. And he said it's going to take 3 more drivers just to make sure that I can guarantee that I can deliver your gas. It's going to take 3 more. I talked to another employer, and he's got 275 employers. He's a little bit larger employer. And it's really unique kind of business. It's a business that takes a lot of training. But he said it's going to take 90 more employees so that I can guarantee that I can do this. He said my payroll will need to increase by over $5 million. That's the stuff that matters. It isn't the 0.35 that's as big a deal. It's what these employers have to do, and it's a terrible market to find new employees. Nobody can. Even in God's country, in Ottertail County. Expanding a business. I've had businesses say, what do they want us to do? Do they not want us to expand here? These businesses that have, operations in maybe a couple states. And they said, do they not want us here? Do they want us to look somewhere else? There's no good reason I need to open that next expansion here. And here's a really good example of what someone just told me is the reason why it's a poor business environment in Minnesota. So I talked to a person that said, he's looking at buying a business. And that business is it's a $900,000 business. And it looked like it was worth it. He looked like it in paper. This guy's a businessman. He knew what he was looking into. And he said, with everything going on, I can't justify that. And so he went back to the person selling the business and he said, you know what? It's just bad timing right now. I can't do that. And the guy came back a couple weeks later, and a couple weeks later, and a couple weeks later. This has all happened this year. But now the price is at $250,000, and the guy's begging him to take it. And he said, I just can't do it. It's just not the right environment. And if you think that's a good deal, you're in the wrong side of business, because that doesn't create taxpayers. And that's what's happening here. This needs to go back because you need our input. Representative Baker had a great plan. He said, Murphy, when you hear this plan, you're going to wet your pants. It was a really great bill. I had to use the restroom right away, but it was good. And I think it's one of those things where we need to work together, and this is a really big deal. That plan offered options. It offered the ability to opt in. It offered great benefit to employees. The employers today treat their employees very well. And if you ask around in your areas, you'll know the same things. But Democrats are talking about it in my area, and they're talking to people in your area, and they know what's going on, and they know it's bad. You need to spend some time with us, so we need to send this back so we can work on this. We can work out a good middle ground on this. I don't think your ideas are bad that we need to make sure we look out for employees, but we need to do it with employers, not against them. So, thank you. I think we need to send it back.
I recognize the member from Wright, Representative Hudson, who's not in the chamber, so we'll get back to him soon. Representative Mueller.
Thank you, Mr. Speaker, and thank you, members. You've heard many reasons already about why we need to send this bill back to conference, from the process, from leaving 48% of Minnesota out of the conversation. And yet I keep hearing the word good, historical, and frankly, you keep using that word, but I do not think it means what you think it means. So I think we need to go back to what I was talking about yesterday with the word transformational. This will be transformational. But again, like I said yesterday in the education debate, that might not transform Minnesota the way you think it will. Businesses will forever be changed. I've received at least 20 emails about how this will change our job providers. This one of my providers said this bill will be very costly, and to remain competitive in our market will be very difficult. We will not be able to pass the cost on to our customer. It will simply make staying in business much harder. I have another one. Please visit our local lumber yard in Austin. Step into the shoes of small business. We are a family business who tries to be fair to our employees and do what is best. We have extreme difficulty finding employees as the job is physically demanding. It normally takes 12 to 16 weeks just to find a qualified employee. This would drastically impact our ability to run our business. We are a small business whereby even one is missing for vacation. It impacts all of us. There's no exception. There's no provision that says that leaves some of our job providers out that's going to be the most onerous. There's none of that. And then, if we're trying to be transformational, we will transform our nonprofits. I was talking to someone who came up to visit me, who runs a small nonprofit in my district, and when she found out that this bill would actually also apply to her nonprofit, she looked at me, and I know that this person was not a supporter of me being elected. She looked at me and goes, "Oh, Rep. Mueller, you have to stop this. There's no way. I will have to stop my nonprofit. I will not be able to continue." And I just think what's so frustrating is that while we continue to give millions of dollars to nonprofits, like we heard in public safety, like we heard in education, like we heard in the jobs bill, how we heard in the housing bill, well, maybe we'll have some money left over because they'll just be done after going and having this put on them. And then our schools will be forever transformed. I predict that we will have many more schools that will be operating in statutory operating debt, that this will actually create a paid family medical leave cross-subsidy, because some of the back of the napkin costs on our schools are this unfunded mandate is about $50 million a year for all of our schools combined. This isn't doable. This isn't possible. We can't, our schools, our businesses, our nonprofits, they can't absorb this. And while you sit in your conference committee with no minority members there, with 48% of Minnesotans shut out, not even allowed at the table, this is something that we need to be sending back to conference committee. We need to be able to think through this, because as much as you tell me, and actually I heard this the last time we were discussing this, we need a unified safety net. That's what I was told. Well, guess what? Not every job is the same. And it doesn't require the same. Things are different. Risks are different. Jobs are different. Responsibilities are different. And you should have the job provider be able to look at what is needed and necessary and possible for them to provide to their own employees. And I'll tell you what, as you're trying to actually protect the employees, what are you going to do when the crushing mandate on our businesses comes down and the best solution for them is to shut their doors? Now what? What will happen to the people that you claim to protect then? I live in a border community. I've had many who told me they're just going to go 15 minutes down the road. It's easier for them. What will you do then, members, for the people you claim to protect and want to make sure that you are going to protect them? What are you going to do when they are no longer have a job? Now what will happen? I don't think we've received an answer for that yet. Members and Mr. Speaker, it's time for this to go back to conference. Thank you so much.
Further discussion on the motion to refuse to adopt the conference committee report for House File 2. I recognize the member from Crow Wing, Representative Davis.
Thank you, Mr. Speaker. Members, I was encouraged not to be long-winded because we got some other things going on. And so I quickly wrote down my thoughts to stay on task. But one thing I just added that came out of Representative Mueller's mouth, and I thank you for that testimony. Representative Mueller was, I believe it was one of her constituents, said, "I will have to stop my nonprofit." I will have to stop my nonprofit. This does need to go back to committee, and Republicans need to be invited and have a seat at the table. I won't go down that road, but I want to quote you something from one of the founders, Samuel Adams. Perhaps you've heard of him. He's not just a beer, Representative Nash. He's one of the signers of the Declaration of Independence. He said this, "If ye love wealth better than liberty, the tranquility of servitude than the animated contest of freedom, go home from us in peace. We ask not your counsels or arms. Crouch down and lick the hands which feed you. May your chains sit lightly upon you, and may posterity forget that you were ever our countrymen." You see, they condemned greed. One thing they did not condemn, though, was liberty. We, the people of the state of Minnesota, grateful to God for our civil and religious liberty and desiring to perpetuate its blessings and secure the same to ourselves and our posterity, do ordain and establish this Constitution. Do you know what that is that I just read right there? It's called the preamble to the Minnesota State Constitution. The preamble, that means it's the foundation of everything written after it. Civil and religious liberty, and this bill is certainly an attack of our civil liberties. Though I do not love wealth, I do understand its value and how it needs to be used in this world for a force of good. But it's not to be forced. It's to be chosen. And it is to be worked for with hardworking hands. And I understand there are some hands who don't have the ability to work for it, and I understand we need to provide for those people. But if you do have hands that can work, you should work for it. And the government should be protecting that. God loves a cheerful giver. And that is what good government protects, freedom and liberty. Our country, the United States of America, is the greatest nation on the face of the earth, and perhaps the greatest nation ever when it comes to protecting liberty for individuals. And if you want to eye roll at that, that's fine, because again, the blood of patriots paid for the way for you to roll your eyes at that. And we have grown as a nation in the pursuit of liberty. We've made grave mistakes, yes, but what nation has not? There's not a single nation on the face of this planet who has not made grave mistakes and grave choices. To condemn our founding fathers and to condemn America for its faults is the biggest hypocrisy in this nation of all. And now America, especially right here in Minnesota, finds itself once again in great need of a change of course, because we have quickly become the most radical state in the Union with a Democrat-controlled trifecta. We've allowed government too much power, and the Democrat side of the aisle is all too eager to grant it. You want to rob Minnesotans of their ability to freely speak their mind. You want to rob them of life in the womb and even out of the womb now with the repeal. You are violating Minnesota's protections from unlawful seizures and passing red flag laws, violating our constitutionally protected rights. And now you want to destroy small business by telling them what benefits they will give and what ones they won't. And we heard a testimony of, I'll have to stop my nonprofit, which Representative Mueller told us. What a dark day in Minnesota. This bill, it reeks of tyranny and government overreach. That's why we need to refuse to adopt. Accept this motion and let's get back to true liberty as legislators. Thomas Jefferson, I'll close with this, in his first inaugural address, March 4th, 1801, he said, "A wise and frugal government which shall restrain men from injuring one another shall leave them otherwise free to regulate their own pursuits of industry and improvement, and shall not take from the mouth of labor the bread it has earned." This is the sum of good government, and what we're doing is we're wrecking small business and taking the bread that they have earned. That's what we're doing. See, men like John Hancock and Sam Adams, they were men that were being overtaxed and overburdened with mandates by government. And you're guilty of doing the same in this Democrat-led 93rd legislature. And my hope and my prayer is that Minnesota will change course and not grant you that power in the 94th legislature. Thank you, members.
Further discussion on the motion to refuse to concur with the Conference Committee report for House File 2. I recognize the member from Washington, Representative Weens.
Thank you, Mr. Speaker. I rise in support of Leader Damas' motion to refuse to adopt. Over time, you've heard things about feasibility, adaptability, affordability. My major concern with HF2 is inclusivity. We want to be heard, and you've heard many stories from this side. One of the things that I've learned in my lifetime, in my career as a military guy, is teamwork. Shona bashona, shoulder to shoulder. We get this done together because in the long run, we working together can solve this. So I've reflected kind of on this particular thing, you know, how does this work? Because there's more than one solution to many things that we do, and how do we come together on this? And I thought back about the summer I graduated from the U of M. I had some time. My brother and I were doing what a lot of guys do in the summer before a big event would come up, and we're playing a lot of sports. And my brother had this peculiar habit of wanting to have compression shorts before compression shorts were available. He would take my T-shirts, he would put his legs through the armholes, and then cinch it up his waist. And I would get these shirts, and I couldn't wear them anymore afterwards because they're all a little soupy, and I was a buff guy back then. And it reminded me of this movie that came out in the 80s. You might have heard of Ruthless People. It was Danny DeVito. And the big tagline there was, "Screw you." But there was a secret weapon in that movie, of which, as we discussed, something we could do, and that was that invention of spandex. Now, while we were doing all these sports during the summer, our father came to us and said, "Na yo jongens, formenering." So, in his language, that is, you boys get off your butts, go do something productive. So we started playing around, and we found that spandex came in a variety of colors and designs. We had a whole bunch of animal prints and a variety of other tropical prints. And we started, basically, got mom, grandma, and some other folks that had sewing capabilities to start sewing up some spandex shorts, compression shorts. Then we also got into a cotton twill covering over that. So, I mean, we were doing all this design stuff, and we had no idea. But we were a little startup business. And from there, I left to go in the Army, do my career there. My brother kept the business, kept on growing it. It's still in Minnesota. I told him, do not leave Minnesota. We are going to fight for small businesses and for employees. And he's still here. I retired from the military, enjoying the benefits of being a retired person, spending time with my family. And then all of a sudden, it was about March of 2020, and I get a phone call from my brother, and it's like, hey, this COVID thing, the governor's going to start closing things down. We got to figure out how the business can survive. How can we do this? Can you come in? So I trundled down to the business, and we set up a crisis action planning. He gets his lead designers, production people. We're all sitting there. We bring in some finance people, and it's like, how are we going to do this? We've got to figure out how to go from an underwear company into providing, specifically, can we make masks and gowns and those things that we need for COVID to become an essential business. And over a 48-hour period, we turned around with designs and started producing and survived the COVID crisis. In fact, it happened to be the most profitable year for the company. And in that whole thing, we took a look, this is that whole thing with Danny DeVito and Ruthless People. Sometimes we look at what comes out of this house as the 100-mile screwdriver that's trying to fix every little problem. And a lot of times it takes all of us at every level and at the heartbeat level to get things done and to do it right. And in doing so, that's the inclusivity part. Because during that time of the year that we were going through this, the head designer had to take maternity leave. We also had one of the production people, their partner deployed. We also had someone that had to take care of an elderly parent. And guess what? We worked with each one of those to find a viable plan so that they could still have income and they had a job to come back to. And we hired people or brought people on with expanded responsibilities to be able to keep the business going. There's more than one way to solve this. And being inclusive is to open your mind up. There's more than one way. And I would just say that just like Danny DeVito said, screw you, don't be the 100-mile screw you driver. Let's listen to people. Let's get things done. And I stand here because I like working with you guys. I want Minnesota to thrive. With that, I would just turn it back and say the dude abides. And when you take a look and you look at Rep. Mike Weiner and myself, I know we get mixed up a lot. But we're very big fans also of Monty Python. And Monty Python, the king would say, I'm the king of the Britons. How do you know he's the king of the Britons? Well, he got crap all over him. Well, I didn't vote for him. So in all of that, just bringing it around, please, let's work together, be inclusive, and I recommend sending this back. Thank you.
Further discussion on the motion to refuse to adopt the conference committee report for House File 2. I recognize the member from Stearns, the minority leader, Representative Dameth.
Thank you, Mr. Speaker. Members, I would encourage a green vote on the motion to send this back to conference vote.
Seeing no further discussion, the clerk will take the roll.
What?
The clerk will close the roll. There being 62 ayes and 68 nays, the motion does not prevail. All those in favor of the motion to adopt the conference committee report on House File 2, please say aye. Those opposed, please say no. The motion prevails. The clerk will give the bill its third reading as amended by conference.
Third reading, House File number 2, as amended by conference.
Third reading as amended by conference. Any further discussion? I recognize the member from Anoka, Representative Scott.
Thank you, Mr. Speaker and members. I know we've had a long discussion already on some of the contents of this bill, and I don't think there's a person in this chamber that doesn't see the value in offering some paid family and medical leave, some sort of a benefit, and most employers that can afford it are already doing that. Our side of the aisle offered a private sector solution that could be in effect as early as this coming January. This is going to take several years to build up. And I want to ask the general public here if they really believe and trust that the state government, who royally fumbled and ran cost way beyond what they were estimated to with Minlars and Minsher, if they trust the state government to take this on. It's going to be a new bureaucracy with over 400 new employees. The cost, the estimated cost, because we really don't know, which is another issue that I'll address. We really don't know for sure what this is going to cost, but they're estimated $1.7 billion. And with the track record that we have in the state with Minlars and Minsher, I'm sure that will only grow and probably grow exponentially. At this time of high inflation, members and members of the public, do you really want another payroll tax deducted from your paycheck? And not only were these other programs that we're talking about, Minlars and Minsher, not only were they super expensive, but they had considerable hiccups when they were rolled out. I want to just take us on a trip down memory lane. I was here at the very beginning. I think Minlars was proposed, and it was either passed in 09 or 08. But I remember them talking about it my first session here. And with Minlars, the estimated cost was $50 million. And it would take several years to get rolling and that sort of thing. Well, in 2012, 2013, another $80 million had to be added onto that. There were still multiple delays. And then there was another $100 million for a brand new, like, push the restart button. And I want to remind the taxpayers of the state of Minnesota that we all bore that burden. We all paid for those mistakes, those extreme government overruns. And MNsure is not any better. MNsure was supposed to cost $150 million and be done and ready to roll out by 2013. It ended up costing over $500 million and was rolled out in 2016. But get this, folks, and I had forgotten this, but MNsure has never really been fully built out. It has not even fulfilled what the original plans were for the website itself. And let's not forget the horrible math that was done before this body voted for MNsure. The horrible, way off estimates. MNsure enrollment was consistently, well, here were the market projections. For 2014, they expected for a low 164,000 enrollees up to 270,000. 2015, they expected 217,000 up to 413, and by 2016, they expected 255,000 to 450,000 people to be enrolled. MNsure enrollment was consistently 50 to 60% below the lowest enrollment projections for many years. Okay? So in 2023, which was the 10th year, there were 103 people enrolled. Now, I think there'll be probably more people enrolled in a product like you're rolling out here today, but I just want to remind you of the math and how horrible the math was. And do we have the same people in charge of doing some of that same math? I'm not sure. We do know that didn't we hire Jonathan Gruber to do a lot of the math for our MNsure because he'd done such a great job with Obamacare. Remember, Jonathan Gruber, let me find his quote. He said, and I want to talk to you first about the lack of transparency and what we know this will actually cost. We haven't even hired an actual actuary, to do the numbers on this. So let's take another trip down memory lane. And it's just inconceivable, but this is what Jonathan Gruber said. Lack of transparency is a huge political advantage. And basically, this will ring a bell with a few of you. He went on to say and basically call it the stupidity of the American voter or whatever, but basically that was really, really critical for the thing to pass. So what I'm trying to do here is open wide the eyes of the public on what this new government bureaucracy is going to cost, and cost you, the taxpayer, and the workers of Minnesota in terms of what it's going to financially cost you. The real answer to that question is we really don't know. And they're going to do these actuarial studies, folks, in October of this year. And I'm just going to go out on a limb and say next year we're going to be back at the table after those actuarial studies come back. And this 0.35 payroll tax with a cap of 1.2, they're going to have to raise that because it's going to cost a lot more money than what we think it is going to. Members and members of the public, I share your desire for a product for these benefits. We all have times in our lives when we need to take time for our own medical reasons or for our family's medical reasons or other things like that. We do. I want you to know that Republicans offered you, and it was voted down by the majority, a product that could start in 2026. But the majority party shot it down. Now they want a supposed Cadillac plan, the best in the country, where you can pay in minimally and maximize the benefit, but it's not free. It's going to cost a heck of a lot of money. Members, this is just not the right thing to do. We shouldn't be doing this. We're doing this prematurely. We should be waiting until after we find out those actuarial numbers in October before we do any action on this bill at all. You don't go out and buy the most expensive car because you want it, and then 9 months later, look at what it's going to cost you when you can't make the payments. You're already not being able to make the payments. That's what we're doing here. And members, it's the right thing to do to wait. If you remember when the rollout of MNsure was happening, and time after time, the administration had mud on their face because of the blips and because of the, what do you call that, when it's unforced errors, the unforced errors that they were having. And it was humiliations galore at that time. Avoid that. Let's wait till we have the numbers, the raw data that we can share with the public. Let the public then weigh in after we really know what it's going to cost. Vote no, members.
Further discussion on the Conference Committee report for House File number 2. I recognize the member from Hennepin, Representative Katiza Watoon.
Thank you, Mr. Speaker. Members, for my first couple of terms, it was sort of an inside joke among our caucus members that every election year, my husband and I added children to our family. We were blessed and overjoyed to welcome 4 children in just over a 2-year period. But happily, that pattern seems to have come to an end in 2022. My lived experience as a parent and a legislator come together in this paid family and medical leave bill. Throughout this process, Representative Richardson has engaged with outside advocates, the business community, and minority members. Over the last 5 years, I've had multiple meetings with my local chamber and business owners on this topic, and particularly important to them were flexibility for small businesses, the option for intermittent leave, and capping the total number of weeks available annually. These accommodations, as well as exclusion for our state's seasonal hospitality industry, have all been made in this conference committee report as amended. The first conversation I had after I was appointed to this conference committee was with Representative Baker. And after conversations then with the Commerce Commissioner, Commissioner Arnold, and staff at the Department of Commerce, I confirmed with Representative Baker that current language does allow third parties to offer private PFML plans, which will give businesses additional flexibility as we move into implementation. I know it's an important provision for our minority members, and it's a new product for insurance providers to bring to market. Beyond the changes that we've made in partnership and support for the business community, this bill is going to make an incredible impact on the children and families of Minnesota. As a foster, adoptive, and biological mother, I know well just how precious and important the opportunity to bond with your children is. Sometimes we have the tendency to look at policy in silos, but policy like paid family and medical leave does not impact the lives of Minnesotans in just one singular way. If we only look at the bonding leave, research has shown that this can improve family life, the physical health of infants and birth parents, the postpartum mental health of mothers. It allows foster and adoptive families to build trust and intimacy. We celebrated Mother's Day over the weekend, members. With this green vote, you can say Happy Mother's Day, Minnesota. But the bill has economic benefits too, like helping women return to the workforce, usually increasing household income, and creating better outcomes and savings in our healthcare system. Minnesotans care for one another, and this paid family and medical leave program will help us get every child in Minnesota off to a great start. It's an investment for Minnesotans, by Minnesotans, and it takes us one step closer to being the best state in the country for kids and families. I'm proud of the work we've done, and I'm excited to vote in support of this conference committee report. I hope you'll join me. Thank you, Mr. Speaker.
Further discussion. I recognize the member from Candy-Ojai, Representative Baker.
Thank you, Mr. Speaker and members. I guess I think I just want to apologize to a lot of the small businesses out there that this is it. This is the final day, the final battle of the reasoning that we were trying to bring to the majority here in the Minnesota House. to try to bring you a product that you could offer your employees, because I know that's what you want to do. We tried everything we could to offer options, to customize a program that best fits your business. We tried everything we could to make sure that families do matter and that you are able to do something for them as part of your employee benefit package. And we couldn't get their attention. I think they just don't understand what it's like to do everything you can for those amazing employees that you employ, and yet we couldn't stop this runaway train to bring some reasonableness to this, some options that would really work, because we actually started this session out trying to do the right thing. We offered carve-outs, if you want to call it that, because carve-outs is something that we're going to start hearing more about. We wanted to offer an exemption for the smallest businesses so that you could, as you build up to be a bigger business, we wanted to give you some time to build that up with the employees that kind of knew the options that you offered to your employees, but that you were doing everything you could for those folks working for you. We wanted to give you some time to build up, because that's what we do in Minnesota. We're a great entrepreneurial state. We're a great incubator state. We want people to start their businesses here, grow and expand, and then just thrive. We want you to make money. We want you to share those profits with employees. We want you to have these employees buy nice houses. Isn't that the dream? That's the dream that we all care about. It sure is for me. I'm so proud to be a small business owner, and I do everything I can, but I can't do it all. But I thought we were trying to do something better. And this bill, it could have been so much better because it didn't have to come with a huge payroll tax that's coming your way here in about a year and a half, 2 years. If we would have taken the bill that was offered on our side, the Minnesota Family Leave Act that I think we kind of came up with, we could have started that in 6 months from now. January 1st of 2024, we could have started a private option right now. But right now, it's not offered in Minnesota. The way that this is kind of built where you can have a paid family leave disability short-term act, it's not available right now. We could have had it ready by January 1st, 2024. So the folks that now have to wait 2 more years, and all the families that are going to have children between now and then, I'm sorry. We failed you. We failed to bring a product to you because the majority thought they just had the one and only product. They didn't want to look at a private option. Don't even talk to us about that. It's part of the whole system this whole year is that they just don't want to, they want to listen to reason. So I'm sorry for those new families that are planning this beautiful thing called life, that you're gonna be cheated about this deal because we could have had something going for you this coming January. I think that again, the government here in Minnesota, with the amazing, arrogant leadership of what's going on in the executive branch, just thinks that whatever we do here, we know it all. This benefit, along with the other heavy mandates that are coming to businesses, they have no understanding about the balance that we do when we offer our benefits to our employees. And that's a shame. This is going to be a very heavy burden for businesses, and that's shame. It's shameful because it could have been done so much differently. They just completely missed the mark. Again, the actuary is coming out in next fall. I think it's due on Halloween Day, October 31st. The actuary, when it comes out and they say the rate isn't high enough, guess what? They can make that change right there. This 0.7 we keep talking about, just like that, bang. It can be changed up to 1.2%. That's a 74% increase when the actuary comes out. Let's see what happens. Now the actuary is going to see, oh, well, wait a minute. They got $1.5 billion sitting in the checking account here, so that's going to take away that initial sting. And that's true. $1.5 billion. You know how much the nursing homes need that? Do you know how much we could have done so much good with that? And yet we couldn't find the money for that. And right now, again, I have applauded the work on our Human Services Committee that finally wrapped up today, and we did a lot of good things in that, but we didn't go far enough. But every bill we pass now, folks, has to have an asterisk by it when it comes to employees, because the things you think you're going to give up to them and give to them, whether it's in disability services or nursing homes or new government jobs, there needs to be an asterisk, because now there's a payroll tax coming right behind it. We're going to give you some, we're going to take some right back. This is just a bad way to write legislation. It's a bad way to work bipartisanly, because you're never going to get a single, you're not going to get any votes on this, because it's a bad bill from our side, and that's what's sad. So, again, I'm sorry. I'm sorry to the business owners. I'm sorry for the chambers and the small retailers and the grocers that were in your offices and sharing their concerns about this bill. And they kept hiding behind, but they're hearing from other people that they really want this. You know, don't buy that. Don't buy it for a minute. This is another example of us failing miserably in Minnesota to make it a better place to grow families, to provide opportunities for business owners that want to invest everything they got, and to try to make this the best state it can be. This is going to be one of the sessions that's going to be remembered for a long time, because members on this side of the aisle, we have a lot of work to do to correct this mess. This is not something that we're going to stand for, and we're going to fix it, because this is a terrible way to provide a product that could have been done so much better. So again, I urge a big red vote on this thing, because I'm embarrassed that it's coming out of the Minnesota State House. We could have done so much better. Thank you.
Final remarks on the repassage of House File 2 is submitted by conference. I recognize the author of the bill, the member from Dakota, Representative Richardson.
Thank you, Mr. Speaker. I heard a lot today. We've all heard a lot today. And what I heard is that no Republicans were on the conference committee, and I just want to lift up that it is custom, if folks want to be on the conference committee, to vote for the bill. I've heard that paid family medical leave is anti-American. That's what I heard from my colleague on the other side of the aisle. The majority of Minnesotans don't believe that, because Minnesotans believe in caring for each other. I heard that we need to think about our young people. And if we're thinking about our young people, we don't want to have people needing to cut their bonding time short to return to work, which is something that happened with Margaret Sita. Margaret testified with me in committee 9 months pregnant, and was forced to cut her bonding with her little one short because she couldn't afford to take leave from her school counselor position. We've heard about IT concerns, and that's a reason not to move forward with this. But we're ignoring that Minnesota was the first state in the nation to set up the pandemic unemployment insurance program during the COVID pandemic. And we're also ignoring the fact that 13 states have, in fact, put paid family medical leave in place, and we have the opportunity to learn from them. We heard about the KSTP polling on the other side of the aisle today. And you know what that KST polling said? 64% of Minnesotans support the bill the way that it's written. And what they were asked is, would you support a payroll tax? And Minnesotans overwhelmingly said yes. We've heard about the Minnesota Family Leave Bill that was presented, and that we failed by not following that model. Well, that model was tried in New Hampshire, and that in fact failed. The vast majority of people in New Hampshire are not covered by a paid family medical leave program. And the idea that the success of a program is based on how few people that we can cover, that's not what we're trying to accomplish here, and that's not what's best for Minnesota. I heard today that every worker is covered in this bill, and that's not correct either. I wish that every worker in Minnesota was covered within this bill, but in fact, there are carve-outs in this bill. I heard that this bill was front-loaded with $1.7 billion and $1.5 billion, and in fact, what's coming from the general fund from the surplus is $668 million. I heard that we're not helping nursing homes. There's $20 million in this bill to help nursing homes. I heard that if you need a benefit, you should work for it. This is in fact a benefit that you earn by working for it. I heard that, we want that people's ideas were not included on the other side of the aisle. And I just want to spend a little bit of time talking about the ideas that came up in committee on the other side of the aisle and in conversations that were in fact included in the final bill that we are taking up today. A timing change, delaying by 6 months. That was a suggestion that came from the other side. Having a cap on premiums, that is a suggestion that came from the other side. Having an actuarial study. We've had multiple modeling studies related to this bill, and we're taking a belt and suspenders approach with another modeling study, with an actuarial study. An idea that came from the other side, that is in this bill. We were told to reduce the number of weeks in this bill. We've reduced the number of weeks within the bill that is before us. We were told to not cover everyone. We're not covering everyone. There is in fact a carve-out for seasonal workers within this bill. We were told that we should ensure that there was a cause, that there was in fact a way to hold people accountable for fraudulent misrepresentation. That is in this bill. We've heard a lot about the costs of this bill, and I've talked about the costs of not doing this bill before, and I won't go down all of the figures in terms of what we can save as a state, but it's important to note that the cost of infant mortality, the cost of maternal mortality, the costs of long-term care facilities, those are all costs that we are bearing right now as a state. When people choose not to return to the workforce because there is not a safety net for them, those are costs that employers are bearing right now within the state. This idea that someone is going to have a heart attack or a stroke or cancer and just continue to show up to work every day is not a realistic one. And what happens when we have a system that is designed the way that our system is designed, where you can opt in to provide it, it comes down to luck. Am I lucky enough to have an employer who sees my humanity? Am I lucky enough to be in a space that I can care for myself when I need to? Am I lucky enough to be able to care for my child when I need to care for my child? And it shouldn't come down to luck. Any of us can be one serious condition, one accident away from financial devastation. And that is why it is a good day in Minnesota today, because we are listening to the vast majority of Minnesotans. We are listening to the vast majority of Americans across party lines who say we need access to paid family and medical leave. We are the only nation to not offer this, and we can do it, and I'm proud to vote green, and I hope you'll join me. Thank you.
The clerk will take the roll. The clerk will close the roll. There being 68 ayes and 62 nays, the bill is repassed, is amended by conference, and its title agreed to. I recognize the member from Hennepin, the Majority Leader, Representative Long.
Mr. Speaker, I move a recess to the call of the Speaker until 7 p.m.
Representative Long moves a recess to the call of the Speaker. Is there any discussion related to the recess? Representative Dameth.
Thank you, Mr. Speaker. Republican members, we will be caucusing in our Capitol Caucus Room at 6:30.
Representative Long moves a recess to the call of the Speaker until approximately 7 p.m. All those in favor, please say aye. Aye. Those opposed, please say no. The motion prevails and the House stands in recess.